Hello. A very good morning, one and all, the respected dignitaries, speakers, sponsors, faculty of Hamsa, and the students of Hamsa. HMAT welcomes you warmly. So, before starting the session, let us talk about the importance of today. Today is October 23rd. First and foremost, today is World Mole Day. So, as you all know, Avogadro number is 6.022 into 10 to the power of 23, right? So this 10 to the power of 23 is nothing but 23rd of October. So all the chemists around the world will take a holiday from 6 a.m. to 6 p.m. remarking the mole day. So the next important thing is today is also Medical Assistance Importance Day. So we need to also give importance to all the medical assistants who will assist us in doing many things and make our lives more better way. And most importantly, today is Sudden Death Syndrome in Epilepsy Awareness Day. So these 3 days, these three important things are marked on October 23rd. So before making any delay, we will start our session. So we'll be having two sessions, that is morning session and afternoon session in between the lunch break. So morning session is nothing but Sri Kandula Venkata Narsingh Rao and Sri Manikya Memorial Oration. And afternoon we'll have Srimati Rajrani Kapoor Memorial Oration. So first starting with the first session, Srimati Kandula Venkata Narsingh Rao and Srimati Manikya Memorial Oration, which was sponsored by Dr. K.S. Gupta and family. So first of all, I would like to call upon our President, Dr. Gopalakrishna Garu, onto the dais. Our General Secretary, Dr. G. Durga Prasad Rao sir. Speaker of the first session, Dr. Samir Chaukar sir from Mumbai. Hamsa Chairperson, Dr. Umesh sir. Sponsor of today's event, Dr. K.S. Gupta sir. Vice Principal of Hamsa College, Dr. Srinivas Babu Kati sir. Thank you for the morning boost. Then ICRH Director, Dr. Venugopal Gauri sir, onto the dais. So every session is a beginning of a new thing. And every beginning is the beginning of all the good things, and it is marked by lighting the lamp and remembering the God. So now I request all the dignitaries to proceed for the light lamping ceremony. Thanks to all the dignitaries. Thank you, everyone. So now to embark the beginning melodiously, I call upon Dr. Harshita Bure ma'am for the prayer song. Welcome her with a big round of applause.
प्रणम्य शिरसा देवं गौरीपुत्रं विनायकं भक्तावासं स्मरे नित्यम् आयुः कामार्थसिद्धये प्रथमं वक्रतुण्डं च एकदन्तं द्वितीयकं तृतीयं कृष्णपिङ्गाक्षं गजवक्त्रं चतुर्धकम् लम्बोदरं पञ्चमञ्च षष्ठं विकटमेव च सप्तमं विघ्नराजेन्द्रं धूम्रवर्णं तथाष्टमम् नवमं बालचन्द्रं च दशमं तु विनायकम् एकादशं गणपतिं द्वादशं तु गजाननम् द्वादशैतानि नामानि त्रिसन्ध्यं यः पठेन्नरः न च विघ्नभयं तस्य सर्वसिद्धिकरं प्रभो विद्यार्थी लभते विद्या धनार्थी लभते धनं पुत्रार्थी लभते पुत्रा मोक्षार्थी लभते गतिं जपेत् गणपतिस्तोत्रम् षड्भिर्मासैः फलं लभेत् संवत्सरेण सिद्धिं च लभते नात्र संशयः अष्टभ्यो ब्राह्मणेभ्यश्च लिखित्वा यः समर्पयेत् तस्य विद्या भवेत् सर्वा गणेशस्य प्रसादतः।
Thank you, ma'am. So before processing the event, I would like to call upon Dr. Annapurna ma'am to take over the dais to continue the further sessions.
Thank you, Chamundeshwari. A very good morning to one and all. Moving ahead, I would now like to call upon Dr. Gopal Krishna sir, President HMAT, for welcoming and addressing the audience today. Dr. Gopal Krishna sir.
Good morning, everybody. Hearty welcome to you all to Sri Kandula Narsingrao, Srimati Manikyam Memorial Oration being organized by Homeopathic Medical Association of Telangana. The distinguished speaker of this morning, Dr. Samir Chaukar from Mumbai, and our General Secretary, Dr. Durga Prasad Rao, and today's sponsor, Dr. K.S. Gupta, and Vice Principal, Dr. Srinivas Babu Katti, and our ICRS Director, Dr. Venugopal Gauri, and our executive members, Vice Presidents, Dr. Manik Prabhu, Dr. Rajeshri, and Dr. Sabita, Dr. Raghuram, and all the faculty members of Hamsa Homeopathic Medical College, and dear interns, students, and PG scholars of Hamsa Homeopathic Medical College. We extend a hearty warm welcome to you all to this memorial oration. Sri Kandula Narsingrao, Srimati Manikyam Sparka Memorial Oration is instituted by Dr. K.S. Gupta, one of our vice presidents, Managing Director, Star Homeopathy homeopathy, and he is very generous and able organizer, and he every time supports us in all our activities. And on this occasion, we extend our heartful thanks to Dr. Gupta and his family for generously donating the amount to organize this event annually. Today, as Dr. Chamundi said, today is World Moles Day. So probably you are all aware what Moles Day is. The students pursuing chemistry would be more aware. So this is Science Week. So this particular day, 23rd of October, is Moles Day. So to mark the Avogadro number. So we all know how important the Avogadro number is. So all the students should take inspiration for participating on this day in an educational activity. So we once again congratulate you, and we extend a hearty welcome for having come here. And we also thank the management of Hamsa Homeopathic Medical College and faculty members of Hamsa Homeopathic Medical College for associating and participating in this event. Thank you, one and all.
Thank you, Gopal Krishna sir. Next, I would like to invite onto the dais Dr. Durga Prasad Rao sir, General Secretary, Homeopathic Medical Association of Telangana, for speaking a few words and telling about our activities at HMAT. Sir.
Thank you. Good morning, all. Respected President Dr. Gopal Krishna sir, our beloved speaker, the Dean of Batras International Homeopathic Academy, and internationally famous practitioner of homeopathy for more than 30 years, Dr. Samir ji, and our ICRH Director, Venugopal Gauri, Star Homeopathy Managing Director, and today's sponsor, morning session, Dr. K.S. Gupta, and Hamsa Homeopathy Medical College Vice Principal, Dr. Srinivas Babupatti, and Governing Council members, all the faculty of the Hamsa and the students of Hamsa. First, let me pay my heartiest tributes to Sri Kandra Narsingarao and Srimati Manikyam, on whose memory today we are conducting this morning session. And you are all aware that HMAT is the only association in South India for catering the services permanently for annual basis, all throughout 365 days, OPD clinics on the name of in the name of Dr. C.L. Modi Charitable Dispensary, and various specialty clinics attended by senior and expert homeopathic physicians in different faculties like ENT, gastroenterology, behavioral problems in children, urinary system, and ENT, pulmonology, skin, and gastroenterology, and gynecology, and male sexual and female sexual problems. Like that, so many specialties we are conducting periodically. And apart from these medical services, we do train the house physicians posted by different homeopathic colleges for to increase their clinical acumen. And also we conduct seminars nationally and statewide seminars calling eminent physicians from all over India. And apart from this monthly orations, every month one oration or two orations in the name of some great persons. Now today like this, and our regular activity is this monthly oration. So in memory of the Kandra Narsingarao and Manikyam. And apart from orations, our ICRH is the Institute of Clinical Research in Homeopathy, which we conduct. We are compiling the clinical data from our OPDs and specialty clinics for future generations and to do any research projects in future. And preventive medicine also, we are supplying all the epidemics and pandemics, right from brain fever to recent corona. And in this connection, I thank all our sponsors and philanthropists for their generous contribution in doing all these services. And especially thanks to Hamsa Homeopathy Medical College and particularly Dr. Umesh Akkaladevi Garu, the chairperson of the Hamsa Homeopathy Medical College and Hospital, and for their generous were voluntarily coming forward for to conduct a program like this, a day with Hamsa, and the involving their faculty to present the cases and other topics. And the Hamsa, to join with Hamsa is fostering the sensitivity of learning and in the students and making convergent with the skills and continuous learning. This is the purpose that we conduct the this colleges programs here, inviting them to our HMAT. And today it is our lucky we are associated with Hamsa people. And thanks to speaker, last but not least, we profusely thank our speaker, Dr. Samir Ji, for readily accepting my request and all the way coming from Mumbai and to give this talk today. The credit goes to our Vice President, Dr. Rajashree Shah, who initiated and who contacted Dr. Samir Ji and made for acceptance. And now today we are hearing from Dr. Samir Ji the children's remedies in day-to-day clinical practice and differential diagnosis. And particularly, I want to quote one thing about Hamsa. Hamsa is for purity. Hamsa is for divinity. Hamsa is for intellectual. So that's why the name Hamsa itself is involves so many activities with good mind and peace and the happiness. So that's why the Hamsa credit goes to Umesh Akkaladevi Garu for coming over here. And thanks for your patient hearing. Thank you.
Thank you very much, sir. Next, I would like to invite Dr. Gautam Ralabandi, Assistant Professor, Department of Repertory, Hamsa College, to speak a few words about Hamsa.
A very good morning to one and all. Distinguished speakers, guests, our HMAT President, General Secretary. I know the majority of the audience already know about Hamsa. So just recalling. So Hamsa Homeopathy Medical College, a trusted destination for holistic and natural healthcare. Since its establishment, the management has been committed for providing exceptional homeopathic services tailored to diverse health needs. Hamsa Homeopathic Medical College was founded in 2017, offers world-class education and training for future practitioners, while a state-of-the-art homeopathic hospital opened in 2016 delivers advanced treatments with a focus on compassionate, patient-centered care. Our pride lies in our extensive network of clinics, ensuring quality homeopathic care is accessible to communities for far and wide. Our mission is to promote wellness through excellence in education, innovative research, and compassionate patient care. With over 600 free health camps conducted, we have served over 30,000 individuals, demonstrating our commitment to the community health. Our partnerships with institutions like L.V. Prasad Aya Hospital and Gajwel Area Hospital enhance our training programs, while our initiative with Mahatma Jyotiba Phule School provides essential health awareness to the students. We also offer a supportive environment for students with a 300 capacity girls hostel on campus. At Hamsa, the management embraces the holistic philosophy of homeopathy, respecting the body's innate healing abilities. Our core values being integrity, compassion, innovation, and collaboration guide us in our pursuit of superior health outcomes and educational excellence. A little regarding our director, Dr. Umesh Akkaladevi, started the college with a vision to make homeopathy as a mainstream medical system. His clinical experience over the years have made him realize homeopathy can make wonders if the physician understands the basic principles of homeopathy. This has led him to start a homeopathic medical college, which produces well-trained and society-ready homeopathic physicians. All through his journey, he has a pillar who supported him unconditionally and has been there since the beginning. That is his wife, Dr. Padmaja Akkaladevi ma'am. Dr. Umesh sir's vision to make homeopathy available in nook and corner of Telangana is continuous. So we welcome the Hamsa College to HMAT. Thank you very much.
Thank you, Dr. Gautam. Next, I would like to invite onto the dais Dr. Umesh sir, who is the chairperson and faculty of Hamsa, to speak a few words about Hamsa Medical College. Yes, he is yet to come. Next, I would like to ask and invite Dr. K.S. Gupta sir to come onto the dais and address the guests. Please, sir.
Happy morning. ఈ సభకు విచ్చేసిన పెద్దలకు, డయాస్ మీద ఉన్న గెస్టులకి, స్పీకర్కి అండ్ స్టూడెంట్స్ అండ్ ఫ్యాకల్టీ మెంబర్స్ మనస్ఫూర్తిగా నమస్కారం చెప్తూ, ఈరోజు ఎంతో శుభదినం. ఎందుకంటే మై ఫాదర్ అండ్ మదర్ వాళ్ళకి రుణం తీర్చుకునే అవకాశం ఈ హెచ్మ్యాట్ అసోసియేషన్ నాకు కల్పించినందుకు మనస్ఫూర్తిగా కృతజ్ఞతలు చెప్తూ 2 విషయాలు చెప్తాను. I started the clinic at 1996 at Ambarpet, 120 square feet, small clinic, very, very small. 120 square meter అంటే almost now మీ బాత్రూమ్ అంత సైజ్. 1996. ఈరోజు స్టార్ హోమియోపతి ఆయుర్వేద, we have 9 branches in Telangana, Andhra Pradesh. And I am one of the shareholder and director of the FETI-9. It is the IVF centers. We have 13 IVF centers in Andhra Pradesh and Telangana. Recently, we started hair and skin. That's cosmetology clinics in Hyderabad, 2 branches. Almost, we have 650 employees with us, doctors and different faculties. ఇది ఎలా సాధ్యమైంది? It is a span of 25 years, not much. Only 25 years. I came from the business community, business family. My father is business చేస్తుండేవారు మా నాన్నగారు. చిన్న పల్లెటూరు, బైరీపురం అనే విలేజ్, విజయనగరం డిస్ట్రిక్ట్ ఇన్ ఆంధ్రప్రదేశ్. చాలా చిన్న ఊరు. మాకు నేర్పింది ఏంటంటే పని చేయడం కాదు, మనస్ఫూర్తిగా పని చేయడం. వాట్ ఎవర్ ద వర్క్ యూ డూ ది హార్ట్ఫుల్లీ. అందరూ వర్క్ చేస్తారు. బ్రెడ్ మన ఫుడ్ గురించి, మన బ్రెడ్ గురించి మనం అందరూ పని చేస్తాం. కానీ మా నాన్నగారు చెప్పేది ఏంటంటే యూ హ్యావ్ టు డూ హార్ట్ఫుల్లీ. మనస్ఫూర్తిగా పని చేయి. ఏ పని చేసినా, చదివినా, టైంపాస్ చేసినా, వర్క్ చేసినా మనస్ఫూర్తిగా పని చేయి. చిన్నప్పటి నుంచి చెప్పి 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 ఏ పని చేసినా, అదర్వైజ్ డోంట్ డూ. ఆయన ద్వారా కష్టపడ్డాం. అందరూ చేస్తాం. డెఫినెట్లీ ఎవ్రీ వన్ డూ. కష్టపడకపోతే మార్కులు రావు, పైసలు, మనం ఎగ్జామ్స్ పాస్ కావు. బట్ మనస్ఫూర్తిగా పనిచేయడం అలవాటు చేసుకోండి. వన్ మోర్ థింగ్ ఈజ్ యూ హ్యావ్ టు గివ్ ద ఎక్స్ట్రా. మా అమ్మ దగ్గర నేర్చుకున్న మాట ఏంటంటే ఎప్పుడు, షీఈ్ హౌస్ వైఫ్. 40 మెంబర్స్ ఉండేవాళ్ళు మా ఇంట్లో, బిగ్ ఫ్యామిలీ. ఫాదర్కి 4 బ్రదర్స్, 6 సిస్టర్స్ ఉండేవారు, కంబైన్డ్ ఫ్యామిలీ. ఎప్పుడు మా మదర్ ఎమోషన్, ఎప్పుడు ఆల్మోస్ట్ చిన్నప్పటి నుంచి నేను పెరిగినంత వరకు ఎప్పుడు మదర్ అంటే కిచెన్. ఎప్పుడు కిచెన్లోనే చూశాను. మా అమ్మ నేను హాల్లోని టీవీ ముందు కూర్చొని, అరుగు మీద అప్పుడైతే అరుగులు ఉండేవి, రోడ్ సైడ్ కూర్చొని చిట్చాటింగ్ చేయడం నేను ఎప్పుడు చూడలేను. ఆల్వేస్ నేను ఎప్పుడు ఏం మాట్లాడాలనే కిచెన్కి వెళ్ళి అమ్మతో మాట్లాడాలి. కానీ నేర్చుకునే విషయం ఏంటంటే యూ హ్యావ్ టు గివ్. ఇంటికి ఎవరైనా వస్తే ఏం పెట్టాలి, వాట్ యూ వాంట్ టు గివ్, అండ్ రిటర్న్ గిఫ్ట్ ఏమి ఇవ్వాలి. ఇదే ఆలోచన. ఇంటికి వచ్చిన వాళ్ళకి ఏం చేస్తాం, గెస్ట్లకి ఫుడ్ పెడతాం. నెక్స్ట్ వాళ్ళకి ఏమి ఇవ్వాలి, ఎక్కడికైనా వెళ్తే ఏం తీసుకుని పోవాలి, ఎక్కడికైనా వెళ్తాం ఫంక్షన్స్ కానీ పార్టీస్ కానీ వాట్ ఎవర్ మేబీ, ఏం తీసుకెళ్ళాలి, యూ హ్యావ్ టు లెర్న్ గివ్. మనం 20th సెంచరీలో ఉన్నాం. మన బాధలకి మన సంతోషానికి కారణం ఏంటంటే తీసుకోవాలి. మరి ఆ ఎమోషన్ ఎక్కడి నుంచి వచ్చిందో నాకు తెలియదు, కానీ యూ హ్యావ్ టు లెర్న్ గివ్. దిస్ ఈస్ ద లవ్. గివింగ్ ఎమోషన్ ఈజ్ ద లవ్. ఇవ్వడం. ఏమిస్తాం? నీ దగ్గర ఏది ఉంటే కదా ఇవ్వడానికి, లేకుంటే ఏమి ఇవ్వగలం? జస్ట్ థింక్. యాజ్ ఏ డైరెక్టర్ ఆఫ్ స్టార్ హోమియోపతి, ఐ హ్యావ్ టు థింక్, నా ఎంప్లాయీస్ నేనేమి ఇవ్వాలి, నా పేషెంట్స్కి ఏమి ఇవ్వాలి. ఇంటికి వెళ్తే యాజ్ ఏ హస్బెండ్ నా చిల్డ్రన్కి నేను ఇవ్వాలి, నేను మా వైఫ్కి ఏమి ఇవ్వాలి, మా రిలేటివ్స్కి ఏమి ఇవ్వాలి. యాజ్ ఏ ఫ్రెండ్ నా స్నేహితులు నేను ఏమైనా ఇవ్వగలనా. యాజ్ ఏ నైబర్, యాజ్ రెస్పాన్సిబుల్ సిటిజన్ ఆఫ్ ఇండియా నేనేమైనా ఇండియాకి ఏమైనా ఇవ్వగలనా. ఎంతసేపు మనకి ఏ ఎమోషన్ వచ్చిందంటే, నాకు గవర్నమెంట్ ఏమీ చేయట్లేదు, మా నాన్న ఏమీ చేయలేదు, మా తమ్ముడు ఏమీ చేయలేదు, మా భార్య అయితే అసలు ఏం చేయలేదు. ఎప్పుడు నెగిటివ్ సైడ్ ఉంటాం. ఫస్ట్ యూ హ్యావ్ టు థింక్ అబౌట్ గివ్. డిఫరెంట్ రోల్స్, వీ హ్యావ్ డిఫరెంట్ రోల్స్. ఆఫీస్లో ఉంటే మేనేజింగ్ డైరెక్టర్, పేషెంట్ చూస్తే డాక్టర్ని, ఇంటికి వెళ్తే హస్బెండ్ని, పిల్లల దగ్గర ఫాదర్ని, ఫ్రెండ్స్ దగ్గర ఫ్రెండ్ని. ఆల్ ఆస్పెక్ట్ ఆఫ్ లైఫ్లో జస్ట్ లెర్న్ ది గివింగ్ ఎమోషన్. గివ్. ఏమి ఇవ్వగలం? ఎప్పుడు మనస్ఫూర్తిగా పనిచేస్తామో, ఎల్లవేళలా ఇవ్వడానికి ప్రయత్నం చేస్తామో, రెస్ట్ ఆఫ్ థింగ్స్ మనం చేయనవసరం లేదు. పైన ఉన్నాడు ప్రకృతి, నేచర్ అనుకోండి, భగవంతుడు అనుకోండి, ఎవరైనా అనుకోండి, ఈ విల్ గివ్. మనం ఎంత అడిగితే, హైదరాబాద్ నేను వచ్చేటప్పుడు 1996లో క్లినిక్ పెట్టినప్పుడు ఒక అపార్ట్మెంట్ కొనుక్కుంటే, ఒక అపార్ట్మెంట్ అందరిలాగే ఒక కారు ఉంటే చాలు అనుకున్నాం. అంతకంటే ఏమనుకోలేదు. ఇది ఉన్నా లేకపోయినా ఫ్యామిలీ పిల్లలు ఎలాగైనా వస్తారు, అది పెద్ద ఇష్యూ కాదు. మనం ఎంత అనుకుంటే పైన వాడు ఎంత ఇస్తాం. ఎప్పుడు ఇస్తాడంటే ఇవ్వడం నేర్చుకోవాలి, తీసుకోవడం కాదు. మరి ఎట్లా ఇవ్వాలి సార్? 500 రూపీస్ ఫీజు తీసుకుంటాం, 1000 రూపీస్ తీసుకుంటాం, 1500 తీసుకుంటాం, 2000, ఓకే. అమౌంట్ ఈజ్ నాట్ నో మ్యాటర్. 2000 తీసుకోండి, 1 మంత్కి మెడిసిన్ ఇచ్చి 5000 తీసుకోండి, మేము ప్యాకేజీలు తీసుకుంటాం. 15,000, 25,000, 30,000 పెర్ ఇయర్ తీసుకుంటాం, తీసుకోలేని అనట్లేదు. కానీ మనం ఏమి ఇస్తున్నాం? ఎండ్ ఆఫ్ ది డే పేషెంట్, యాజ్ ఏ డాక్టర్గా పేషెంట్ హ్యాస్ టు ఫీల్, నేను ఎంత అమౌంట్ ఇచ్చానో నాకు ఎక్కువ వచ్చింది. ఆ ఎమోషన్తో పేషెంట్ ఎప్పుడున్నాడో గెట్ త్రూ. 200 తీసుకుంటే తక్కువ, నేను 200 రూపీసే తీసుకుంటున్నా, 100 రూపీస్ తీసుకుంటున్నా, నేను ఏదో చారిటీ చేస్తున్నాను ఫీల్ కాకండి. వాట్ ఎవర్ ద అమౌంట్ యూ వాంట్ టు టేక్ ఇట్, డోంట్ వరీ, బట్ గివ్ మోర్ దాన్ 500 రూపీస్ తీసుకుంటే 550 రూపాయలు ఇవ్వాలి మీరు. అంత వర్త్ కన్సల్టేషన్ ఉండాలి. మేబీ కన్సల్టేషన్ కావచ్చు, డూస్ డోంట్స్ కావచ్చు, ప్యాటర్న్ ఆఫ్ ఎక్సర్సైజ్ మనం చెప్పే విధానం కావచ్చు, డైట్ కానీ రెజ్యూమిన్ కావచ్చు, వాట్ ఎవర్ మేబీ, సర్వీస్ కానీ పేషెంట్స్ సర్వీస్ కానీ, వాట్ ఎవర్ ఇవన్నీ క్యాల్కులేట్ చేస్తే 550 వర్త్ రావాలి, దెన్ గెట్ త్రూ. అందుకు మనకి ఏమైనా కావాలి లైఫ్లో అంటే ఇస్తేనే వస్తుంది. మా గురువుగారు చెప్పారు, మహత్రేయరా. మా గురువుగారు ఎప్పుడు చెప్పేది ఏంటంటే, యూ హ్యావ్ టు గివ్. అలాంగ్ విత్ దట్, వాట్ డూ యూ వాంట్ ఇన్ లైఫ్? చాలా క్లారిటీ ఉండాలి, అదర్వైజ్ యూ విల్ నాట్ గెట్. మీ లైఫ్లో ఏం కావాలి, ఆల్ ఆస్పెక్ట్ ఆఫ్ లైఫ్, వాట్ ఎవర్ ది ఆస్పెక్ట్, ఇప్పుడు పుట్టినప్పటి నుంచి చనిపోయినంత వరకు నీకేం కావాలి, క్లిస్టర్ క్లియర్. అది డిజైర్ అనుకోండి, విజన్ అనుకోండి, ఎయిమ్ అనుకోండి, వాట్ ఎవర్ మేబీ, ఆల్ ఆర్ ది సేమ్. ఏది కావాలో స్పష్టంగా మనకి తెలిసినప్పుడు, మనస్ఫూర్తిగా పనిచేస్తున్నప్పుడు, ఏ ఆస్పెక్ట్ ఆఫ్ లైఫ్లో కూడా ఇవ్వడం నేర్చుకోవడం. నేర్చుకోవాలి. యూ హ్యావ్ టు గివ్. అందుకే ఈ 3-4 ఎమోషన్స్ నేర్చుకుంటే మనం యూనివర్స్ని కానీ ఆ భగవంతుడు కానీ ఎంత అడిగితే ఎంత ఇస్తుంది. అందుకేంటంటే ఇక్కడ పిల్లలు ఉన్నారు కాబట్టి నేర్చుకోండి. డిఫరెంట్ ఆస్పెక్ట్స్ ఆఫ్ అప్రోచెస్ ఇన్ హోమియోపతి యూ హ్యావ్ టు లెర్న్. ఎవ్రీ అప్రోచ్ యాజ్ ఎ అడ్వాంటేజ్ అండ్ డిసడ్వాంటేజెస్. అడ్వాంటేజెస్ చూడండి, అవైలబిలిటీ ఆఫ్ సిమ్టమ్స్, సీ ద అవైలబిలిటీ ఆఫ్ ది సిమ్టమ్స్ అండ్ గివ్ ద ప్రిస్క్రిప్షన్. ప్రిస్క్రిప్షన్ ఒకటే కాదు, మెడిసిన్ ఒకటే పనిచేస్తుందా? రియల్లీ ఇట్స్ విల్ వర్క్. బాడీలో మెడిసిన్ లేకుండా బాడీ ఇట్ సెల్ఫ్ ఓన్ హీలింగ్ మెకానిజం ఉంది బాడీలో. నో నీడ్ టు ఎనీ మెడిసిన్. మెడిసిన్ అవసరం లేదు, అయినా బాడీ హీల్ చేసుకుంటుంది. ఆ మెకానిజం మనకు తెలుసు, యాజ్ ఆల్టర్నేట్ సైన్స్లో ఉన్నాం కాబట్టి. అసలు బాడీ ఎట్లా హీల్ చేసుకుంటుందో నేర్చుకోండి. బాడీ హీల్ చేసుకుంటుంది, మెడిసిన్ అవసరం లేదు. నో నీడ్ ఆఫ్ ఎనీ మెడిసిన్. బట్ ఆ స్టేజ్కి వెళ్ళినంత వరకు డిఫరెంట్ అప్రోచెస్ తెలుసుకోండి. నేర్చుకొని మనస్ఫూర్తిగా చదవడం. ఇంకో రోజు లేదు, రేపు లేదు. ఈ పని ఏ పని చేస్తే ఆ పని మీరు ఎంజాయ్మెంట్ అండ్ ఎంజాయ్మెంట్, నో ప్రాబ్లం. ఎంజాయ్మెంట్ చేసినప్పుడు కూడా ఇంకొక రేపు లేదు. ఇప్పుడు ఫుడ్ తింటున్నాం అంటే ఇంకొకటి లేదు. మనస్ఫూర్తిగా పని చేయండి. ఎప్పుడు చేస్తున్నామో రెస్ట్ ఆఫ్ థింగ్స్ మనం ఏం చేయనవసరం లేదు. మనకి ఏం కావాలో క్లారిటీ ఉంటే క్లారిటీ ఉండాలి, లేకపోతే మాత్రం లైఫ్లో ఏది దొరకదు. యూ హ్యావ్ టు. అందుకే లేకపోతే ఏంటంటే ఎప్పుడు మనం నెగిటివ్గా మన బాధల గురించే మాట్లాడతాం. అందుకే మనం ఎస్పెషల్లీ ఆల్టర్నేట్ సైన్స్లో ఉన్నాం కాబట్టి అలోపతిలో ఫెయిల్ అయిన ఒక కేస్, సింపుల్ మైగ్రేన్ హెడేక్ ఉంటుంది. సింపుల్ హెడేక్, మైగ్రేన్ హెడేక్, మన లెక్క ప్రకారం సింపుల్ మైగ్రేన్ హెడేక్. ఒక అలోపతి హాస్పిటల్కి వెళ్తే, న్యూరోఫిజిషియన్ దగ్గరికి వెళ్తే, అపోలోకి వెళ్తే యశోదాకి వెళ్తే కిమ్స్ కాకపోతే సమ్ ఎక్స్ న్యూరోఫిజిషియన్ దగ్గరికి తిరుగుతుంది. కానీ హోమియోపతిలో ఏమవుతుంది? హోమియోపతి మందులు వాడేను తగ్గలేదు. ఓకే, డాక్టర్ శ్రీనివాస్ గుప్తా దగ్గర వాగాను తగ్గలేదు, సార్ గోపాలకృష్ణ గారి దగ్గర తగ్గాను తగ్గలేదు, డాక్టర్ వేణుగోపాల్ గౌరవ్ దగ్గర తగ్గలేదు అన్నారు పేషెంట్ ఏమంటారు? హోమియోపతి వాడైనా తగ్గలేదు. అంటే హోల్ సిస్టమ్ విల్ ఎఫెక్ట్. బీ కేర్ఫుల్ అబౌట్, బీ కేర్ఫుల్. అలోపతిలో ఆ ప్రాబ్లం లేదు, ఆ డాక్టర్ దగ్గర తగ్గలేదు, ఆ హాస్పిటల్లో తగ్గలేదు అనుకుంటారు. ఎండ్ ఆఫ్ ది డే హోమియోపతిలో ఏంటంటే హోమియోపతి ఆయుర్వేదిని ఆల్టర్నేట్ సిస్టమ్స్. పేషెంట్స్ ఏమనుకుంటారంటే పేషెంట్స్ ఆర్ కస్టమర్ ఏమనుకుంటారంటే హోమియోపతి తగ్గలేదంటారు. అందుకంటే ఆ ఎమోషన్ వాళ్ళు ఫీల్ కాకుండా డాక్టర్ గారు మంచిగా ప్రయత్నం చేశారు, నాకు తగ్గలేదు అనే ఎమోషన్ ఇవ్వాలి. ఈ డన్ ఈజ్ గుడ్ జాబ్, ఎంత బాగా ప్రయత్నం చేశారంటే, కానీ నాకు తగ్గలేదు, నా కర్మ సిద్ధాంతం ఒకటి ఉంది, తర్వాత ఎప్పుడో టైం ఉంటే మాట్లాడుకుందాం. డిఫరెంట్గా అనే ఫీలింగ్ ఉండాలి. తగ్గకపోవచ్చు, తగ్గితే నో ప్రాబ్లం, తగ్గితే నో ఇష్యూ. ఆ ఎమోషన్ కావాలి. అందుకేంటంటే ఎప్పుడు మనస్ఫూర్తిగా పనిచేసామో డెఫినెట్గా హార్ట్ఫుల్గా పనిచేస్తే కస్టమర్ అట్లే అనుకుంటారు. అందుకని హార్ట్ఫుల్గా పనిచేయండి. ఈ ఆపర్చునిటీ ఇచ్చిన మా తల్లిదండ్రులకి, హెచ్మ్యాట్ యాజమాన్యానికి మనస్ఫూర్తిగా కృతజ్ఞతలు చెప్తూ ముగిస్తున్నాను. థ్యాంక్ యూ వెరీ మచ్.
Thank you, sir, for your inspirational words. Dr. K.S. Gupta, sir, has been an integral part of HMAT, always inspiring us with his viewpoints and advices. And today we acknowledge sir for sponsoring this session today on the name of his parents, Shri Kandula Narsingha Rao and Shrimati Manikyam Memorial Oration. Sir, definitely you are an inspiration for the upcoming generation to take homeopathy as well as Ayush to the next level. And you are really inspirational as a person, as a homeopath and a practitioner, sir. Thank you. Moving forward, next I would like to invite Dr. Rajeshri Shah ma'am, who is the Vice President of HMAT, to speak a few words and introduce our eminent speaker for today, Dr. Samir Chopra, sir. Thank you.
Good morning, dignitaries on dais, students and faculty of Hamsa.
committee members of HMAT, and friends. It is a great pleasure to introduce Professor Dr. Samir Chokar, as I know him since my college days, and he's been attached to Dr. Batra's academy for almost 2 decades. He's dean of Batra's academy right now, and he oversees all the faculty and functioning of the association. And if anyone wants to approach him, he is always welcome. He's also worked as a professor at YMT Homeopathic Medical College and PG Institute, Mumbai. He is very good with communication skills and computer literacy and leadership programs. He's also worked with addiction, de-addiction programs at Georgian College or Aurelia, Ontario, and PG Diploma Addictions Treatment and Prevention. I have seen him many times going to Turkey, and recently he had visited Spain for a small conference. He's a very good international speaker, and he has lot of, I think, lot of fan following in Turkey, as I see. And he has presented a lot of papers in on research on autism, ADHD, allergies, dermatology at various national and international seminars and conferences in India, Australia, New Zealand, Malaysia, Turkey, UK, and Brazil. He's also a guest professor for Homeopathic Dernagi of Turkey and Canadian College of Homeopathic Medicine, Toronto, Institute of Flavia Baritis at Sao Paulo, and Abrancan College of Homeopathy, Brasilia, Homeopathic College of Homeopathy, Hahnemann College of Homeopathy, UK. So we are indeed very lucky to have him here, and we all await your presentation, and we invite you to HMAT, and thank you for accepting our invitation. Thank you, one and all.
Thank you so much, Dr. Rajshri ma'am. In the meanwhile, we clear up the stage and ask all the dignitaries to please seat amongst the audience. We have all been much waiting for this session. And now, without much delay, I would like to invite our speaker and eminent physician, practitioner, Dr. Samir Chokar sir, to speak on the topic of children's remedies in day-to-day clinical practice and differential diagnosis. Please, sir.
Good morning, everybody. So till my presentation is uploaded, I'll have a informal chat with all of you. First of all, at the outset, let me thank HMAT, the Homeopathic Medical Association of Telangana. And yesterday, in fact, I was lost. I'll tell you a small story how I was lost. My mobile just stopped functioning at the airport yesterday when I landed. And though I know a lot of people in Hyderabad, all my contacts were on my phone. So once I got down from the flight, my phone was not working at all. I did not know what to do. There was somebody, Dr. Prashant had come to pick me up, and I have to apologize to him also that he had to wait there. The only thing I knew was the hotel name. So I'm just giving you an example because Dr. Gupta was also talking in your mother tongue, so I did not understand most of his speech. But in between, he was talking English, which I understood, and he was talking of giving, and he also said something about once you decide, do it. Right? So 2 or 3 things I could understand from his speech. And that's what yesterday I did, Yesterday I only had one goal, is to reach to all of you today, somehow or the other. So I got a cab. I knew the hotel name. So I came to the hotel and then somehow connected to everybody. So the aim of telling you this is that you should be very, very clearly aware of what you want in your life. That is very, very important. Long time back, when I was teaching in a homeopathic medical college, and even before that, I always wished that I should go abroad. And I wanted to travel because traveling is one of my passions. And I'm sure you've seen that Shah Rukh Khan movie, jahan he talks about shiddat se aap mango to puri duniya aapke, something like that. And there was a movie called Shiddat also. I don't know whether you've seen it. That guy was in love with somebody and he wanted to swim across the British Channel to get to London for her. So that is Shiddat. So in homeopathy, what we need is Shiddat. And what we need is today's day, when we talk about mole day or whatever, we should know that we have gone beyond that. Homeopathy is beyond Avogadro's number now. That's why we were known as quacks. Lancet called homeopaths a quack. Why? Because we were saying that only up to 30 potency we were able to find out the molecules or substance of arsenic or whatever remedy. Now, there is one friend of mine, Dr. Rajendran. I don't know whether you know Dr. E.A. Rajendran from South, who has done a tremendous work on nanomolecules. He's written a lot of books. I meet him regularly at conferences. He's from Kerala, I think, Dr. Rajendran. So even in LM potency now, LM1, LM2, LM3, LM10, you can find out the substance by nanomolecules and electron microscopy. So nobody can call us that it is just alcohol or it is just placebo effect of homeopathy. It is proved beyond doubt, right? So we know. So once we know what we are doing, we should be having an exact plan of what we are doing, remember. So as I was telling you, thinking and planning all the time, and ultimately all these positive waves come to you and ultimately you get what you want, remember that.
I guess he's waiting for us.
Excuse me. We acknowledge the presence of Dr. Umesh Agarwal Garu, the chairman of Hamsa Homeopathy College, Hospital and Research Center. Thank you, sir, for coming over. Thank you.
I don't know why it's not.
Presentation. So meanwhile, before all this is said, we want to talk about so I think we'll start now. So, welcome all of you, and I'm really happy to be in front of you today. Dr. Umesh, hello, good morning. And students of Hamsa College. And so today I'm going to share a very, very important thing. And since students were there, interns were there, I thought it is best to plan a pediatric session because pediatrics forms the major part of our practice, remember. Of course, skin and autoimmune diseases are also on rise, but pediatric practice is a very important way to progress in your practice because parents, they bring their child out of anxiety, which is very, very important, remember. Even a small thing to the child and the parents run to the doctor and they expect the doctor or the physician or the homeopath to do whatever he can in order to prevent the child from getting any complications, right? And
Wrong. Why? Anybody? Because there, Sina is acting as an anti-helminthic, like albendazole, tinidazole. These are the remedies. Mebendazole. These are the azoles which we give for worms, the allopathic doctors, right? So Sina, if constitutionally given, has to create an environment which is unfavorable for the worms, and the worms should come out like this. तड़प तड़प के बाहर आना चाहिए उनको. Are you getting it? जैसे बोलते हैं ना सवेरे वाले गाड़ी से चले जाएंगे. So that is how the worm should come out, remember. So never ever think of giving Sina as a worm remedy, because Sina is not a worm remedy. Sina will create an environment if it is a Sina patient, remember. And that's where I want to tell you that chamomilla and Sina are very, very close. Many a times when your chamomilla will not act, Sina will 100% act. And I've seen it. Child is howling, crying. The rubric is quieted, cannot be. If you have the repertory, if you have the phone repertory or anything, look at the rubric. Crying cannot be quieted. He cannot be quieted by any means. पेरेंट्स आके बोलेंगे इसके सामने इसको गले में ले लो, उसको उठा ले लो, उसको नीचे रखो, रोने का बंद नहीं करेगा वो. एंड आपने कैमोमिला दे दिया है, सब कुछ दे दिया है, बट इट्स नॉट एक्टिंग. सीना विल एक्ट बिकॉज सीना इज इन द रूब्रिक क्वाइटेड कैनॉट बी. इट्स द ओनली रेमेडी. Another third remedy that will come crying. In fact, that will come with a mother with all the hair like this, साड़ी इधर इधर उधर हो गई है. मदर उसको बेचारी थकी हुई मदर उसको लेकर आई. एंड चाइल्ड को आप देखोगे तो हंसता हुआ. एंड मदर बोलेगी, मदर को आप पूछेंगे ये तो हंस रहा है, आप तो बोल रहे ये रो रहा था. तो बोले आपके पास एक दिन रखो और आप देखो कैसा है ये बच्चा. दिस इज द रिएक्शन ऑफ द मदर ऑफ विच रेमेडी? Third remedy, which is very, very torturing remedy. Remember, torturing child. Arsenic. Can you imagine giving arsenic to a child? Have you given anybody? Arsenic is a very, 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 very important remedy, children remedy. But the most important thing is always ask the mother, how is the child during the attack? Not when he comes to you. Because by the time they come to you, they have given some medicine. He's tired, he's sleeping, he's like a very अच्छा बच्चा. And you think इतना अच्छा बच्चा आपको थका तो रात भर मेरे को चलते रहना पड़ा था. Can you imagine? This is what is arsenic. And therefore my favorite rubric in arsenic is biting the tumbler. Have you heard of this rubric? Biting the tumbler? Tumbler वो है जो हमारी प्यास बुझाता है. Arsenic, beat a child, beat a man, beat a woman, beat the mother-in-law, father-in-law. Biting the tumbler is the most important thing. जो सबसे ज्यादा मेरी परवाह करता है, जो सबसे ज्यादा मुझे केयर करता है, जो सबसे मुझे ज्यादा संभालता है, उसको मैं काटूंगा या काटूंगी. By काटूंगा I mean I will torture that person. I had a person who had chronic headaches. This lady came to me. This man came to me with chronic headaches and I told him, कल रात को सर मुझे बहुत सर दर्द हो रहा था. अच्छा तो आपने क्या किया? कुछ गोली वगैरह ली, कुछ दवाई ली? नहीं दवाई नहीं ली, मेरी वाइफ है ना. मैंने बोला तो वाइफ है तो क्या? नहीं वो रात भर मेरा सर दबा रही थी. Imagine the wife of that person massaging his head whole night, not sleeping even one wink. And then he says, wife है ना, करना तो पड़ेगा उसको. This is what is arsenic. So rubric is moral feeling want of. Desire to be a criminal without remorse. कोई पछतावा नहीं उसका. फ्री में बोल देंगे कि उसने ऐसा कर दिया तो क्या हुआ, उसको तो मेरी वाइफ है, उसको तो मेरा सर दबाना ही है, रात भर जागना ही है. उसको गर्म पानी बोलता हो तो गर्म पानी लेके आएगी. नहीं नहीं गर्म थोड़ा ठंडा करके लाओ तो ठंडा करके लाएगी. रात भर उसको भगाते रहना है. दैट इज आर्सेनिक. आर्सेनिक चाइल्ड इज ऑल्सो द सेम. उसको लेके घूमना पड़ता है, लेके घूमना पड़ता है. द मदर अल्टीमेटली इतनी परेशान हो जाती है, वो बोलती है डॉक्टर को कि आप रखो इस बच्चे को. बट ही स्माइलिंग ऑन योर फेस. रिमेंबर दिस इज द डिफरेंस बिटवीन सीना, कैमोमिला एंड आर्सेनिक. सीना, कैमोमिला will be continuously howling. Arsenic in front of the doctor will smile and he will allow you to examine. Sina, chamomilla will not allow you to examine. So this is very, very important. As soon as the patient enters, The case taking. One of my friends, he's written a book on case taking before case taking. Because your case taking does not require book and writing down and looking down and continuously looking at the rubrics. You just need to look at the patient. Remember that. Most of our patients, after few years of practice, I am telling you this now, maybe 30 years of practice, but I'm telling you that I have lost so many cases and I have failed in so many cases because I was looking down. I was looking at the computer. I was trying to search rubrics. And I was trying to write down the history vigorously. आपको खाने में क्या पसंद है, आपको पीने में क्या पसंद है, टॉयलेट कैसा होता है, सपना क्या आता है, जबकि उधर सामने मेरे केस था. एक लेडी आई थी, उसको भी माइग्रेन था बहुत सालों से. आपने इतने टाइम से दवाई क्यों नहीं लिया? हस्बैंड उसके साथ था, वो दोनों ऐसे बैठे थे, मैं उनको देख रहा था. मैंने जब भी उसको पूछा कि आपने इतने दिन से दवाई क्यों नहीं लिया, सो शी जस्ट नीचे देख रही थी. उसने ऊपर देखा और अपने हस्बैंड को एक तरफ देखा और बाद में वापस नीचे देखा. यही अगर लिखता रहूं कि हेडेक है, एग्रेवेटेड कोल्ड, बेटर बाय प्रेशर, तो ये जो एक सेकेंड का जो शी लुक्ड एट हर हस्बैंड, आई वुड हैव मिस्ड हर एंड आई वुड हैव मिस्ड द रेमेडी. व्हाट वाज द रेमेडी? Ignatia, why? Yes, somebody. Show me your hand. Somebody said it. Morals, yes, tell me moral. इतने साल से मुझे तकलीफ थी पर तुम लेके नहीं आए, बट फिर भी मैं तुम्हारी कंप्लेंट नहीं करूंगा. Somebody said rightly, moral, sensitive to moral impressions. They are very, very moral people. They'll never talk against their husband. They'll never talk against their mother-in-law. कितनी भी परेशान करे. Have you come across such patients like this? So climbing over the shoulder. Now climbing over the shoulder, look it at a broader way. It's not only a child. Remember, clinging or carried desires to be carried is not a rubric for child. For many years, for maybe 20, 25 years, I was using this rubric only for children. But it is not a rubric for children only. It is a rubric for any and everybody. डॉक्टर साहब, मुझे आज के आज आप ठीक कर दो, कैसे भी ठीक कर दो, इंजेक्शन दे दो, कुछ भी दे दो, पर आज के आज कैसे भी ठीक कर दो मुझे. आप ही कर सकते हो, बिना आपके तो कुछ होगा ही नहीं. दिस इज क्लाइंबिंग ओवर द शोल्डर. रिमेंबर, carried desires to be carried fast. Belladonna, arsenic, all these patients are there. Now remember, arsenic, how will you give on this symptom? To a man. This man is going to come to you with some kind of urgency. He's going to tell you, do something. And they are talking of business, remember. Arsenic is number one businessman, just like Brian here, remember. Therefore, it is very, very difficult to differentiate between arsenic and Brian here. Many times, they are always doing some kind of business. आप मुझे ठीक कर दो, जल्दी से जल्दी मुझे जाना है कल जॉब पे. So what is the concern of the patient is very, very important. आपको ठीक क्यों होना है? This is what I always tell my students, that when a person comes to you with fever, what does he come to you for? Yes, anybody? Somebody coming to you with fever, what is he coming to you for? Yes, ma'am. For relief, okay. Anybody else? When he is coming to you with fever, is he coming to you with fever? Is he coming for fever? फीवर तो है, खांसी तो है, ये सब कुछ घर में कुछ ना कुछ दवाई लेके हम लोग पहले ही ठीक करने की कोशिश करते हैं. रिमेंबर दैट, इट्स वेरी वेरी इंपॉर्टेंट. वी ऑलवेज टेक सम कॉफ सिरप, we go to the local pharmacist, we buy some small homeopathic biochemic here and there, try to do something. एक दिन, 2 दिन, 3 दिन, पहले 2-3 दिन में कोई डॉक्टर के पास जाता नहीं. You all know that, you all are practicing, right? तीसरे दिन क्यों आता है वो? Fear, yes. What else? How does it affect your routine? Exactly. So, क्या बोलेगा? पेशेंट क्यों आएगा? काम रुक रहा है. उसका मतलब क्या? और क्या बताइए? मेरे बच्चों का टिफिन कैसे बनाऊंगी मैं? मेरे बच्चों को खाना कौन देगा? तो आई क्यों है? फीवर के लिए नहीं, बच्चों को खाना कौन देगा उसके लिए आई है. Are you getting it? So find out a concern. This is the concern of the patient. मुझे कल जॉब पे जाना है सर, कैसे भी मुझे कल मेरा बिजनेस मीटिंग है, मुझे कल जाना ही पड़ेगा. He is not come to you for fever, remember that. People don't come for what you think they have come, remember. You have to ask them what is your concern and why you have come. बच्चे को भी 2-3 रात से मम्मी घुमा रही थी, आखिर वो इतनी परेशान हो गई कि वो अभी ये बच्चे को देखो आप क्यों ऐसे आई है वो. दैट इज इंपॉर्टेंट एंड दैट इज द रेमेडी. Instead of going on to fever, chill stage, heat stage, yes, this is all right. Our stalwarts have said ailments from low, chill, heat, sweat, thirst, tongue. Look at all these things. But the easier method is look at the mental state of the child. If you look at the mental state, you have to ask few questions and you come to the remedy very, very fast. Either ways, ask a lot of physicals, ask some mentals, you will come to the remedy. But saving time and accuracy is very, very important. Remember that. टर्निंग हिज फेस अवे फ्रॉम फिजिशियन. बट जब भी हायोसेमस डरेगा, हायोसेमस का डर कैसा होता है, हायोसेमस के बच्चे में डर कैसे होता है, और स्ट्रेमोनियम की आंख में कैसा होता है. स्ट्रेमोनियम की आंख में जो होता है, आई डोंट नो इफ यू सीन सम हॉरर मूवीज, व्हेन आई डोंट नो व्हेन वी वर टॉट स्ट्रेमोनियम, वी वर टोल्ड ऑफ द मूवी कॉल्ड एक्सॉर्सिस्ट. सीनियर डॉक्टर्स मस्ट हैव सीन दैट मूवी एक्सॉर्सिस्ट, जिसमें वो छोटी बच्ची को सामने दिखता है वो डेविल, and she passes urine. So much is the terror, panic, and that is stramonium. So when the person or when the child looks at you with wide eyes and is scared of even you coming near, think of stramonium. And a few keynote symptoms like ये अंधेरे में सोता ही नहीं है, उसको छोटा लाइट तो लगता ही है, ये तो चाहिए stramonium. Remember that. जब भी उठता है तभी आंखें ऐसी रहती है as if he is unconscious. Just day before yesterday, I had a teleconference with one lady in Turkey and her child. She said, I am treating it for autism, constitutionally some other remedy. She said, he just gets up in the night and he's as if unconscious with his eyes wide staring. Stramonium. Hyosamus में suspicion होगा, remember. Hyosamus will be looking here and there like this. क्या करने वाला है ये मुझे, ये डॉक्टर सुई देने वाला है मुझे कि गोली देने वाला है, क्या देने वाला है. सो व्हेन फियर along with suspicion is there in the eyes, think of hyosamus. When there is fear and panic and terror in the eyes, think of stramonium. When there is lot of curiosity, क्या है ये सब, कहाँ मैं आया हूँ, ये कौन सा बुक है, वो कौन सा बुक है, ये कहाँ रखा है, वो कहाँ रखा है, it is sulfur. Remember, it is phosphorus. Phosphorus, sulfur are the two intelligent children who will look at everything in the clinic. They'll observe everything in the clinic. डरेंगे नहीं वो. Phosphorus and sulfur will be right sitting in front of you. Carcinosin will be sitting like a good boy. Natramur will be sitting like a good boy. Silicia will be sitting like a good boy. Baraita calf will be sitting behind the mother. We know the symptom, looking through the fingers. पर ऐसा नहीं होता, ऐसा नहीं दिखता अपने क्लिनिक में जो बुक्स में दिया है. But Baraita calf will look down for sure. Baraita calf will not answer you any questions. There will be a lot of hesitancy. जो हम लोग timidity बोलते हैं सिलिशिया में, उसको hesitancy होती है. What is your name? My name is Samir. Hesitancy is timidity. Remember that. This will be seen in Cilicia child. At the same time, look at the interpersonal relationship when the mother is sitting, the child is sitting, the father is sitting. Whether the child is more inclined towards the mother, more inclined to the father, whether he's sitting on the father's lap or mother's lap, who has come with him is important. Whether the child has entered first and then the parents have come, or whether the parents have come inside and they have dragged the child inside, this tells you much about the child. So case taking before the case taking is very, very important. Observe. Perceive the child. Don't keep writing. If you write, you will lose the case. I'm sorry to say that. You will lose half your cases if you keep writing. Writing is important. Documentation is important. But if you're senior enough, try to keep somebody who can write. But you just keep all your attention, as Dr. Henneman has said, all attentions on the patient. Holding tightly to the parents, clinging, not ready to face the physician, closing his eyes, crying loudly, fearful. Very, very important is child जो भी position में comfortable है, उसमें से उसको position में से निकालो. अगर वो अपनी मम्मी के साथ कंफर्टेबल है, एक कंफर्ट जोन में है, तो उसको पहले बोलो मम्मी को कि इसको निकाल के बेड पे रखो, तभी उसकी रियलिटी बाहर आएगी, तभी उसका रियल सिम्टम्स बाहर आएंगे। जब तक वो अपने नेस्ट में है तब तक उसके कोई सिम्टम्स नहीं दिखेंगे आप। When she puts him on the examination bed and then you approach him, then you will get the antimony crudes and antimony tarts, remember. Otherwise, fear of being approached, doesn't like to be approached, symptom पता कैसे चलेगा आपको, है ना? So put the child in an uncomfortable position to get his reaction. Try to touch him, picking him up, examine him, try to separate him from his mother comfort zone. We always feel that नहीं नहीं मदर के साथ रहने दो, child चुप रहेगा, नहीं ये नहीं चाहिए मुझे. Let him cry, let him touch the things, let him break things. Then only I'll know what constitution is, right? Next slide, please. So in any disease, you have to ask the following. First is nature of the child, family status, who all are in the family. Very, very important. Why it is important? Are we interested in the child or family? अपने को क्या फर्क पड़ता है? मम्मी है, डैडी है, क्या फर्क पड़ता है? Is it important to ask? In fact, I feel this is the first very important question you should ask. Why only mother has come? Why not father? Why only father has come? Why not mother? It's like we always say that when you ask who is in your family and you say, my husband, my mother-in-law, my father-in-law. Thank you, sir. How could you read it, sir? Observation. Does it reflect in my voice? Whenever we speak about our introduction, कि मैं, मेरी wife, मेरे बच्चे, या मेरी wife, मैं, मेरे बच्चे, या मेरे बच्चे, मैं, मेरी wife, कौन है आपके घर में? ये ऑर्डर भी बहुत इंपॉर्टेंट होती है. ये ऑर्डर भी बहुत इंपॉर्टेंट होती है. Many ladies would say, मेरे हस्बैंड है, मेरे बच्चे हैं, मेरी सास है, मेरी ससुर. और मैं पूछता हूँ आप नहीं है? हाँ मैं भी. Ignatius will be like this, remember. Scipias will be like this. Pulsatilla, contrary, will say, मैं, मेरे पति, मेरे बच्चे. These are the myths of materia that we have to break. Remember the pulsatilla, जो छुई मुई सी, selfless, बहुत अच्छी, वैसी नहीं होती. She is the most cunning, most manipulative, most selfish person of materia medica is pulsatilla. सबको प्यार दो, प्यार दो, प्यार दो, लेने देने का कुछ नहीं, मुझे प्यार दो. Somebody said that pulsatilla is like a sponge. Sponge कैसे पूरा का पूरा पानी खींच लेता है, वैसे पूरा का पूरा प्यार खींच लेती है पल्सेट. पल्सेटिला बच्ची होगी, फादर थक के आए हैं, भाग के उनके लैब पे जाके बैठे, नहीं मुझे अभी जाना है, बाहर जाना है. अरे बच्ची मैं थक के आया हूं, मुझे पानी तो पीना नहीं, आप तो मुझे प्यार ही नहीं करते. There is a rubric like that. There is a rubric. You don't love me. Blackmailing in children. Emotional blackmail में number 1 is pulsatilla. So जैसे मैंने कहा, sulfur is not always dirty, pulsatilla is not always अच्छी. Remember that. आपके सामने भी आएगा पल्सेटिला बच्चा या बच्ची, या लेडी आएगी या मेल आएगा, you will feel sorry. Remember, you will feel अरे अरे अरे. This is your reaction coming out for a pulsatilla, and remember, this is the one which is the remedy. Remember, pulsatillas will be like this. One of our friends saw a pulsatilla child. उनके घर में बनी थी मेथी की सब्जी. मेथी is not very, I mean, करेला or something. And every child there said, अरे करेला का सब्जी मेरे को नहीं अच्छा लगता, मैं नहीं खाएगा. Like all children. हमारी पल्सेटिला बेटी क्या बोली, मुझे बहुत अच्छा लगता है करेला, मम्मी दे मुझे और दे मुझे मम्मी, और इधर आ मेरे, मैं तेरे लैब पे बैठ के खाती हूँ. They can go to any extent to get that love. Remember that. This is pulsatility. The way they manipulate, cunning. Now the manipulation of tarantula is completely different. Pulsatilla wants love, therefore she manipulates. But tarantula is totally different. Tarantula threatens the environment. Remember, आजू बाजू में थ्रेटनिंग एनवायरमेंट करता है. कैसे? जैसे ऑटिज्म में आई सी लॉट ऑफ चिल्ड्रन मेल्ट डाउन मीन्स दे बिकम वेरी वेरी वायलेंट, टोटली आउट ऑफ कंट्रोल. यू सी चिल्ड्रन इन द मॉल, मुझे यही चाहिए, दे बैंग देयर हेड बैक, दे लाई डाउन, मुझे यही चाहिए. दीज आर द टैरेंटुलस. रिमेंबर, इतना जोर से रोएंगे, इतना जोर से रोएंगे कि आजू बाजू में लोग कलेक्ट हो जाएंगे. एंड मेनी ऑफ वुड से, अरे कैसी माँ है, एक छोटा सा टॉय नहीं दे सकती. दिस इज व्हाट टैरेंटुला वांट्स. एंड टॉय हाथ में देते ही शांत. Second thing is you have to become very close to Moschus. Remember about these mischievous and spoiled children. Tarantula जब भी सर पटकेगा ना, तभी उसको कभी भी सर पे नहीं लगता है. उसको फिट भी आती है, एपिलेप्टिक फिट्स आते हैं. आई सॉ अ पेशेंट, अ चाइल्ड विद एपिलेप्टिक फिट्स. मदर बोलती है वो कहीं पे भी गिर जाता है. मैं बोला कहीं पे भी गिर जाता है तो उसको कहीं ना कहीं कट आता होगा ना. नहीं, उसको कुछ नहीं आता कट. वो कभी भी गिरता है तो सोफे पे गिरता है या बेड पे गिरता है. This is the feigning. So the main rubric of tarantula child, tarantula male, tarantula lady, feigning illness. Feigns to be ill. Now feigning कोई सामने से आपको बोलेगा नहीं. Feigning आपको find out करना पड़ेगा. So it's on you to find out this symptom. मेरे बच्चे को डायरिया होता है, जब भी एग्जाम आती है ना तभी डायरिया हो जाता है. कौन सा रेमेडी? Argentum nitricum. What is the logic behind it? एंजाइटी नहीं, कामचोर. सबसे बड़ा कामचोर रेमेडी इन होम्योपैथी इज अर्जेंटम नाइट्रिकम. क्योंकि जब भी बस आने वाली है, जब एग्जाम आने वाली है तो पेट दर्द होता है, थोड़ा बहुत वॉमिट होता है. जब बस चली जाती है, एग्जाम का दिन चला जाता है तो खेलने लगता है. सो ये सब रेमेडीज फेनिंग में है. इफ यू लुक एट द रूब्रिक फेनिंग, यू विल सी द लॉट ऑफ रेमेडीज. यू विल सी अर्जेंटम नाइट्रिकम, यू विल सी पल्सेटिला, you'll see tarantula, you'll see moschus. 4 remedies, and you have to differentiate these remedies. Now you know how to differentiate these 4 remedies. Why pulsatilla faints? Why moschus? Moschus is a spoiled child. Remember, बहुत सालों के बाद पैदा हो गया. 14 साल शादी हो गई और अभी पैदा हो गया. Oh, he's my prince, she's my princess. उसको जो चाहिए वो देंगे. दुनिया में जो भी मांग तू तेरे को मिलेगा. जिस दिन आप उसको दे नहीं पाए उसको जो चाहिए, then you will see what the real moschus is. Therefore, Fatak writes, spoiled girls, and they will abuse and they'll shout so much till they turn blue and they fall faint. They faint. Now, moschus or tarantula में यही फर्क है कि moschus actually will get injury. Remember, they'll go into such solid hysteria that they will break their head. Remember that. That's how you'll differentiate tarantula and moschus. Remember, it's very, very important in hysteria, in feigning, in lot of behavioral problems, moschus children from tarantula children. At the same time, how will be the tuberculinum child? उसको एक ऐसा झापड़ मारा तो बोले हाँ चल मार, और एक मार, और एक मार, मुझे नहीं लगता जा. ये बच्चा जहां पे भी जाता है हमको शर्म आती है लेके जाने को. दैट इज ट्यूबरक्लिनम. ट्यूबरक्लिनम जो भी है वो सामने करेगा. मस्ती करेगा तो सामने करेगा, तोड़फोड़ करेगा तो सामने करेगा. और जब टैरेंटुला चाइल्ड यहां वहां ना हो तो उसकी मदर बोलेगी देख लो कहां पे वो कुछ ना कुछ करता होगा. दैट इज द डिफरेंस बिटवीन ट्यूबरक्लिनम एंड टैरेंटुला. देयर इज नो कनिंगनेस इन ट्यूबरक्लिनम. रिमेंबर, cunning, selfish, manipulative, deceitful are all the symptoms of the spider. Remember, spider and the snake. But snake is much more clever. Remember, tarantula is not as clever. Tarantula is a small insect. Tarantula is a spider. Live life king size. मैं आज के लिए जी रहा हूं, कल का पता नहीं. This is the motto of the spider. Snake का ये motto नहीं. Snake का मुझे बहुत जीना है पर मैं प्लान करके जीऊंगा, मैनिपुलेशन करके जीऊंगा. Snake people are planning. There is no planning in tarantula. Remember, are you getting it? This is how you differentiate. Okay. Whether the father and mother are working, this is also very, very important. Are you putting the child in creche? Many a times when there is a woman who's taking care of the child, there are instances when the woman is not good to the child, when the parents are not there. Remember, and then the child develops all pathologies.
So it's very, very important to see who's the woman in charge when the parents are going out. Of course, nowadays parents, they put CCTV and everything, of course. Not getting enough affection from parents, grandparents play a major role. मम्मी ने नहीं दिया ना, मैं देता हूँ. मम्मी बोलेगी इसके दादाजी ने, नाना जी ने इसको पूरा स्पॉइल करके रखा. That's how Moschus is formed, remember. That's how tarantulas are formed. Spoiled children, remember. Okay? Allowed to do anything by parents or grandparents. School report is very, very important because most of the lycopodiums you will catch like this, remember. I've seen so many lycopodiums where the mother says, ये घर आके totally change हो जाता है. मैं जब भी टीचर के पास जाती हूँ तो टीचर बोलते हैं ये बहुत अच्छा लड़का है, बहुत इंटेलिजेंट है, सब कुछ मानता है, पढ़ाई अच्छा करता है, पर ये घर आके इतना मस्ती करता है, इतना टॉर्चर करता है हमको. This is what is torture. And the rubric is hard on inferiors, sweet with superiors. There are only 4 remedies in this. What are the 4 remedies? Lyco, Platina, Veratrum, and Lachesis. Only 4 rubrics, only 4 remedies. Very easy to differentiate, right? Next. Next slide, please. The door is closed, I mean. How many years after marriage is child born? Whether the child is precious child, more care, so falls sick more enough, remember. What does the child do during sickness is very, very important. Ask this question. This is very, very important because when the child is brought to you, he is in a different state, remember. रात भर उसने क्या किया वो आपको मालूम नहीं. वो सुबह आया है तो अपनी मम्मी के लैप में सोया हुआ है. तो वो सोया हुआ है, वो पिक्चर देख नहीं सकते आप. You'll have to find out what the real picture was. How and what his concern was during illness. How does he react? Whether he was irritable, whether he was bearing the pain, lamenting. You see opium children. Opium children, if you see, if you want to give injection or do blood test, they'll immediately give their hand. And they won't even wink. You know the opium numbness, right? They don't feel the pain. Painlessness of symptoms. Opium, stramonium, all these remedies. Of course, stramonium will not allow you because there's a lot of fear of injury in that, right? Smiling. Arsenic बच्चा होगा वो आपको देख के smile करेगा. That is what is the basic difference between nux vomica and arsenic, right? In fastidious, when we used to see Kent's repertory, there were only 2 remedies in fastidious. Arsenic and nux vomica. What is the meaning of fastidious? Cleanliness. Order. What else? Anybody else? Hard to please. Exactly. What do you mean by hard to please? So how will you differentiate nux vomica and arsenic children and hard to please? Very good. कुछ भी करो खुश नहीं होते. It's nothing related to cleanliness. Remember, another myth. Fastidious माने clean. नहीं, fastidious has nothing to do with cleanliness. दूसरों से काम करवाता है ठीक है, बट क्यों करता है? आर्सेनिक को समझो साफ सफाई बोलनी है हमें या फेस्टिडियस बोलना है, तो क्यों है फेस्टिडियस? Anybody, somebody knows the systems who can talk about it? Arsenic and nux vomica? Somebody there? Arsenic, आपने कभी देखा है? मैं क्या करता हूँ? I'll give you my example. जब घर पे कोई मेहमान आता है ना, तो घर पे सब चीजें इधर उधर इधर उधर पड़ी रहती है, बराबर? मेरे शूज यहाँ पे रहते हैं, मेरे सॉक्स यहाँ पे रहते हैं, मेरे शर्ट पैंट सब कुछ यहाँ वहाँ रहते, पेन पेंसिल सब कुछ. बेल बजती है, मैंने देखा अरे मेहमान आया, तो मैं भाग के सब चीजें है ना नीचे छुपा देता हूँ, सोफा के नीचे, बेड के नीचे, और बाहर से. And then I open the door. What is this? Impression. This is presentation. आर्सेनिक सचमुच क्लीन नहीं है. आर्सेनिक को दिखाना है कितना क्लीन है. So arsenic is more concerned with the presentation. नक्स vomica जो हमने बोला है ना कि आर्सेनिक का टेबल कुर्सी सब साफ सफाई रहेगा. Yes, और उसका काम जो होगा फाइल में वो बहुत बेकार रहेगा. जबकि नक्श भूमिका का टेबल आप देखोगे तो पूरा कचरा रहेगा, पर जो फाइल काम का है वो परफेक्ट होगा. Because नक्श भूमिका, the one word which describes नक्श भूमिका is quality. तो एक बच्चा भी जो नक्श भूमिका है, 3-4 साल का बच्चा जिसको नक्श भूमिका दिया गया था, one case I remember of one of my friends, he said that you know those stencils are given, right? A B C D A B C D. So A normally हम लोग ऐसे लिखते हैं A and then you do this, right? He was doing this for at least 20-25 times because उसका A ठीक तरह से नहीं आ रहा. This is the fastidiousness of नक्श भूमिका. Hard to please. जब तक वो ठीक नहीं होगा तब तक वो करता रहेगा. आर्सेनिक तो वो हाँ अच्छा दिख रहा है, ठीक है, टीचर ने मान लिया अच्छा है. नक्श भूमिका जब तक मुझे नहीं लगता ठीक है तब तक मैं करते रहूं. आपको समझा? So now you can differentiate. हाँ. Exactly. That's why Nux vomica is in the rebel party. You know, whatever they do, even if they go to party, even if they go anywhere, it will be perfect. जैसे बिरयानी का एग्जाम्पल दिया आपने, तो आखिरी के अंदर के बिरयानी के ऊपर थोड़ा बादाम पिस्ता वगैरह डालो, अंदर क्या है ये तो छोड़ दो. बट Nux vomica उसको 10 बार टेस्ट करके देगा, जब तक वो टेस्ट करेगा तब तक वो नहीं. That is the difference. Now this is even children in school. Therefore, there is nothing like children level, there is nothing like that. All levels are all. So let's not think that, oh, chamomile is right. So chamomile can be the package thing. You see one movie of British director, which was the patient also starting. Color समझते ऐसा movie? हम लोग को यही कहना है कि starting the husband, starting the radical of this, that is chamomile. So why not be chamomile? Chamomile also good remedy for ear pain. And actually, pulsatilla also remedy. But see the temperament. Look at pulsatilla, look at chamomile. Can you give pulsatilla for all types of ear pain? No. If the person is irritable, snappish. Snappish का मतलब क्या है? One thing that you need to know. Chamomile को आप अगर stethoscope ऐसा करोगे ना, प्राइवेट चीज से जाए तो एक चीज, पर आर्सेनिक ऐसा करेगा. Why? The arsenic wants to show that is a very nice present. Chamomile is not concerned about presentation. Chamomile is not concerned about society. Chamomile is concerned only about self. The main problem with chamomile is it cannot bear it. You know the change is a particular right in the first paragraph it says cannot bear it. थोड़ा भी पेट बर्दाश्त नहीं कर सकता. Therefore, it is one of the good remedies for bad effects of too much coffee. Coffee से क्या होता है? Hypersensitivity होता है. Hypersensitivity होता है sensitive. How is he at home? How is he at school? How is he with friends? Where is the father? How is the auntie? Why the father has not come to consideration? Ask this. मम्मी के साथ ही क्यों आया है? डैड के साथ क्यों आया है? और घर पे कौन है? घर पे लड़की घर पे है. क्योंकि हम लोग उसी को लेके गए. क्यों लेके गए? उसको आप क्या लेके आए थे? Information about how they treat their daughter, how they treat their son. Absent father, abuse, parental discord, reaction of the child, addiction to the family, very, very important. Next slide. Look at the eyes. Eyes में आपको बहुत कुछ पता चलेगा. About use doctor on he used to say that dementia है वो आपको आँख से पता चलेगा. आँख में नहीं. That kind of sadness, that kind of only the main important physical dementia. So the final routines of dementia. It's concerted. Have you heard of this movie? It's concerted. Concert होता है. Concert में आप देखते हैं म्यूजिक डायरेक्टर होता है. और सब लोग एक ही फिल्म में अच्छी तरह प्ले करते हैं. उसमें से वायलिन वाला बोलते हैं ऐसे करूँगा, ऐसे करूँगा. ऐसा लिखना होगा. क्या हो गया? This chord. सब कुछ अच्छी तरह हार्मनी में चल रहा था. सडनली कुछ आ गया और प्रॉब्लम. This is the disconcerted phase. इग्नेशिया बहुत अच्छी है, सब कुछ काम कर रही है, सबके लिए कर रही है, सब उसको परेशान नहीं कर रहे हैं, किसी के बारे में कुछ गलत नहीं है. Until she reaches to a level, it's what is possible. At that time, she can become very bad. But she keep her morals intact. She never let go of her morals. As compared to tractor mule. Tractor mule गाड़ी देगी, tractor mule is standard. Ignition is not the rubric slandering. Ignition is not the rubric moral in bottom. It is the rubric sensitive to moral. Are you getting it? So these rubrics are very important. So how the patient enters? Namaste sir. Out के अंदर ये कितने लोग पूछते हैं? कितने लोग दरवाजा पूछते हैं? हेलो डॉक्टर कैसे हैं? ऐसे ही. डॉक्टर मैं बैठूं क्या? कितने लोग आपको बोलते हैं? ये छोटी-छोटी बातें बहुत जरूरी है. Ignitia, carcinosis, initial 100%, many times 90% will ask you thoracic. Or they'll ask their mother. Carcinosis will ask the mother. क्या बोलूं मम्मी? मम्मी जब भी बोलेगी बैठो तो वो बोलेगा. Thanks carcinosis. आपको उसका खुशी कंप्लेंट है मदर आएगी. मदर आपको मालूम है बच्चे का पूरा बच्चा का पूरा कंप्लेंट का होगा. एक ही मदर है वो बोलेगी मेरे बच्चे का मुझे कुछ भी कंप्लेंट है. That's it. That is the teaching point of personal student. The mother says, I don't have any problems. The school has no problems. But we have to provide problem for him. But still he goes to school. Doctor, during fever भी पढ़ाई करता है. मैं उसको बोलती हूँ आराम कर फिर भी बोलते हैं पढ़ना है. तो फीवर के टाइम पे बच्चा क्या करता है ये इम्पोर्टेंट है. इसी प्लेइंग ड्यूरिंग फीवर पहले लोग बात बड़े-बड़े एक्सेस देंगे बच्चों में. बड़े-बड़े टॉन्सिल्स होते हैं, बिल्कुल टॉन्सिल्स होते हैं, पर वो खेलता है. क्या करता है? सिर्फ वो फीवर के पिक्चर से आया वो फीवर का पिक्चर मत देखो. उसकी मम्मी को कुछ नॉर्मली जब ये ठीक नहीं होता, फीवर होता है, कोल्ड होता है, कॉफ होता है, तो क्या करता है? So he just lying down, he is not doing anything. People diarrhea disease. Diarrhea disease and that's only. What are the this here? Disturb avoids to. They don't want to be disturbed. They want everything to be cool. So many ladies, many people migraine and other is a common symptom. कि मुझे कोई डिस्टर्ब करे मुझे अच्छा नहीं लगता. मैं पूरा अंधेरा करके सो जाती हूँ. मुझे कोई आवाज नहीं आता. तो आपको तीन रेमेडी में डिफरेंशिएट करना है. कोई भी इंटरेस्ट जहाँ पे ये सब क्लोज एनवायरनमेंट चाहिए. दस हो गया वैसे में होता है. थोड़े से फिजिकल सीरियल अगर देखो एंड यू कैन क्रिएट द इट इज सो सिंपल. दबा के एक्स करते हैं, ठंडी में करते हैं, गर्म करते हैं, कोई जरूरत नहीं. वो होम्योपैथी वेरी सिंपल. लेट्स डू वेरी सिंपल. So look at the eye softness, sharpness, dyspnea, delicate, even studying. Analytical, always analytical, like this is they are always from the side of their eye. Remember, when they are looking down, they look at it like this. This is important. You have to look at that side. When the mother is talking, or when the mother says something odd, you look at the mother. It is like that. So that thing is a very important. इसको कुछ भी बोला तो बोलेगा ऐसा करें. He had a case of respiratory without trying to rectify it also. And then angry for trying to based only on that threatening current level. So threatening is a very important point. Whether he is restless, hyper, slow, timid, aggressive, outgoing, obedient, disobedient. Find out what is the diet, what is the diet. Remember, when you are talking about mental symptoms, yes, you are mental symptoms, but ultimately also support your prescription by some cravings, aversions, sleep, thirst. These are important ones. Many times, remedies will fall alike, actually when you see. So physically craving for sleep, or craving for lemonade, or craving for lime, or craving for lemon. सिर्फ lemon खाता है, ऐसे बहुत सारे बच्चे हैं. Salt ऐसे खाता है. Very simple. Ice-cream बहुत सारा. Position. Any of my restrictions are based on the sleep position of the child. Remember, sleeping on the stomach, on the abdomen, the knee chest position. So you got better enough, circular pause, working enough. Arsinosis, very, very important. Two remedies, very, very important. Arsinosis and better enough. Better enough के लिए what is the final question that you asked? ये दिन में ज्यादा एक्टिव है कि रात में एक्टिव है? आपको सोता ही नहीं है सर. मालूम नहीं इसको क्या होता है. 11 बजे के बाद उससे तो भूख आ जाती है. रोता है एकदम. रात को पढ़ाई नहीं कर सकते. 3-4 बजे पढ़ाई कर सकते. दिन में नहीं करता, रात को करता. More active during the night than day. This is the pinching point of better. कटे फ्रूट्स अच्छे लगते हो. कटा एप्पल, ग्रीन एप्पल, प्लम्स, ये सब अच्छा लगता है. सोता है पेट में. जब ये हम लोग सी पे जाते तो उसका एक्टिविटी बहुत अच्छा हो जाता है. They are always better at the sea. So these 3-4 points and you can think on them. Otherwise, it's not a very simple thing. Remember, in autism, ADHD, hyperactivity, recurrent coughs and colds, think of better. Next. Playing, very, very important. I ask you to make the illness. How is the child? खेलता है कि नहीं खेलता? आपको बताना है कि नहीं, बच्चा बताता है कितना भी दूर होता है तो बता देता है. सबसे रेमेडी है. दो रेमेडी आप सोच सकते हैं. एकदम शरीर उसका गर्म होता है फिर भी आपको बता देते हैं. Opium transfer is not created. Second is popular. Very, very important. कभी मुझे परेशान नहीं करता. बेचारे लोग आपको अस्पताल आके कहते हैं आपको उठा कर नहीं. सुबह उठ के पता चल जाएगा. मम्मी बोली सुबह उठ कर पता चलेगा इसको आपको सब्जी दी. कभी आपको जवाब नहीं. Accept the reality. He will never populous, you know, the mentality of populous. Very, very mild, they are really nice people. And they accept the reality, whatever it is. They don't want to disturb. Even if old people, remember somebody with arthritis, old lady, he will never wake up anything. That's why pareshan ho jayenge, usse uthane. That is problem. Very, very selfless. So are they leaders or followers? Now remember, lycopodium is both a leader and a follower. You know how? अगर कोई सीनियर होगा उसको फॉलोअर रहेगा. तो बच्चों के ऊपर लीडर होगा. Why everybody wants to create his own cloud? Diplomatic. Whether he takes with younger children or peers, imaginative, builder, people make those Lego toys. Is she obsessed with some blanket or toy? Is he rough, pretty things? Love for animals or fear of them? Very, very important. Don't forget to ask this question. Better animals both, remember. Better animals love also and also hatred. The anacardians, many, many anacardians you will see. Cockroach को जब तक वो ऐसा क्रश के पीछे भागता है, cockroach को क्रश करना मुश्किल होता है. इसलिए anacardian. Very, very mysterious. Anacardian के लिए वैसा ailments from dominating father भी होता है. तो उसको पीटेगा, तभी वो anacardian बनता है. Anacardian बनता कैसे है? It's very, very important. Try to evolve the recognition. Always try to evolve the recognition. How competitive or aggressive reaction to physical pain, strains, bumps, etc. Next slide. Whether it's independent or dependent. Silicious varieties are very, very dependent. Pulsatile, they always come with something. Silicia, a person that 35 years are married, but when he came with some headache or some throat problem, he came with his mother. मदर और मदर ही बोलने लगी. ये बेटे को ना मेरे गले का ये है वो मतलब उसको बोलने लगा नहीं वो नहीं बोल पाएगा. बट अगर वो कुछ रॉन्ग बोलेगी तो वो बोलेगा नहीं हम ये लगा तो कैसा है. दैट इज द ऑब्स्टिनेसी आल्सो. Silicea is a combination of obstinacy, ego, and the same time lack of confidence. So in one person you see two things at the same time. You see ego also, you see lack of confidence. Varieties, you always look at the mother. Can you imagine? There was one lady who came to me right at the beginning of my practice. She was heading from UP. And in UP they don't come with their answer because of their father-in-law. So when they came to father-in-law, I was asking her and I asked her about the menstrual period, and she looked at her father-in-law. And I said, आपको मालूम होना चाहिए कि बोले यही बोले. That is the kind of dependency. It's not about a particular state I'm talking about. I'm talking about variety of the different. Cannot decide in you. Cannot talk. They don't have the confidence in that. Next. Next slide. Development needs to be very, very important. Learning to talk, walk, language. These milestones are very, very important. All of you should be aware of these milestones. You definitely even know whether it is a late milestone or early milestone. Whether it is a precautions. If the phosphorus transfers it, precautions also, right? Toilet training, hours of pregnancy is very, very important. Today, this is the main thing that we have to talk to when a child comes. Say or mother very important. Any kind of abuse, whether it is physical abuse, sexual abuse, financial, psychological, any kind of abuse to the mother during pregnancy can surely lead problems to the child. Whether it's something from different cause like first to autism to ADHD to MR, anything. Therefore, many a times the remedy of the mother is the remedy of the child.
Okay, next slide. Sensitivity to pain, better or worse by attention. What happens when parents are fighting? How is their reaction? Sad, horrible story is a very, very good movie. Remember, one of the movies is horrible, sad story affected profoundly. और ये जरूरी नहीं कि क्लियर होने चाहिए या पिक्चर होने चाहिए. ये किसी को कुछ हो गया है, उसकी वजह से भी कोई तकलीफ हो गई. आजू वाले आदमी को भी तकलीफ हो गई, सबसे बड़ी एक तकलीफ शुरू हो गई, तो भी सैड स्टोरी ढूंढनी मिल सकती है. You should know when to apply this movie. Not for many years, when you were Dr. Chandra, when you were OPD, I was CMP on the topic. When we used to attend, this movie was introduced by him, and this was the synthetic revolution. That time, during our time, the revolution was synthetic revolution, like Bartel and revolution. Still, it is a very good revolution for trainings and analysis. It is the best revolution. The term introduced that revolution was in 1986. Yeah, from for you, it is from 1986. So that's what I'm saying. Those repertories are being tested. What we put in our mind is still there. What we learned with our college years, that is what they will see practice. So these are the precious years, remember. हम लोग कितना भी पढ़े बाद में कितने भी सेमिनार्स अटेंड करें, मेरा खुद का एक्सपीरियंस आपको बता रहा हूँ. I'm attending so many conferences, so many seminars. But ultimately, what I've learned in my college days, what I've studied in those days is the one that is useful to me. Studies and whatever you do actually what you study for. Thanks. Family dynamics. So there is a very important rubric, jealousy. Now there are two remedies. Jealousy when the newborn gets all the attention. ये rubric मैंने बहुत बार use किया अपने practice में in children. There are only two remedies. One is English and another is biosecurity. Many times, if you know about autism, I'm sure you know that autism happens due to some event in the life, the child starts regressing. कि माँ बोलेगी बोलना करना फिरना बात करना सब कुछ शुरू हुआ था तो कुछ ऐसा हुआ जिसकी वजह से वापस पीछे जा रही है. That is called regression autism. And this is very, very important elements of it. Take most of the children when there is a second child born,
the second child starts getting more attention.
Like them here again. When the second child is born, always the first child is affected. Remember that. Always. Because somehow or the other, attention is always diverted. The mother has to give attention to the newborn child. Now remember, if the child is Ignatia, as I have told you, the most important thing is morality in Ignatia. Whether it is a 1-year child or a 100-year-old woman, the main crux of Ignatia is moral. मेरा प्यार तू उसको क्यों दे रही है? मेरा प्यार मुझे ही देना चाहिए, उसको नहीं देना चाहिए. इसके लिए मैं कुछ करूंगा नहीं, कुछ मैं करूंगी नहीं, मैं ऐसे ही चुप बैठे रहूंगी. They will not harm the child, they will not pinch the child, they will not do anything to the newborn child. They will protect the child, but they will feel bad inside. And that is the disconcerted phase of Ignatia. मम्मी बोलेगी ये बहुत अच्छा खेलती थी, हंसती थी, इधर उधर नाचती रहती है, मजा करती रहती है, पढ़ाई में अच्छी थी. उसको थोड़े दिनों से क्या हुआ है मालूम नहीं, बात ही नहीं कर रही है. थोड़ा सा बात करती है और अपने रूम में चली जाती है. क्या हुआ था? बच्चा बॉर्न हुआ था, मेरा नया बच्चा घर में आ गया था. बट उसको कुछ करती नहीं है, मारती नहीं, पिटती नहीं, कुछ भी. एज अपोज टू द अदर रेमेडी हायोसाइमस इन द सेम रूब्रिक. जेलेसी है बट विल हार्म द चाइल्ड. रिमेंबर, उसको पुश करता है, मैं जब भी नहीं होती तो पिंच करता है. Isn't it simple? Only 2 remedies. Jealousy में. Now, do you imagine Ignatia in jealousy? We'll never imagine that, right? But it is there in the rubric. But it will not harm the child. This is very, very important. Reaction to new siblings. Parental discord, military family, alcoholism, drugs in the family. Is the child compared with another sibling? Remember silicias, carcinosins. These are all remedies. Lycopodium, they are always compared. They suffer by comparison, remember. दूसरे का बेटा देख कैसा फर्स्ट है, तू क्यों नहीं आ सकता है ना? नेक्स्ट. Reaction to grief, death, frights, even a death of a pet, remember, can, stimulate a Ignatia state, remember that. Because it's a shock, it's a numbness. When you get attached to a pet and the pet dies, Ignatia will be very, very shocked, remember that, okay? Mother's description of pregnancy, as I told you, abuse during pregnancy. Facial expressions देखो उसके. Pupils देखो, how aware the child is of her environment. Next. Skin को touch करो. Moist skin है, cold palms है, hot palms है. See the perspiration, whether it is more here, more in the neck. Also look at the nose, remember. We have symptoms of flapping of alienaceae, remember that. In lycopodiums, antimonitard and bromium. You need to know that also, right? Sweat, the amount, parts that sweat, odor, moles, tongue. Very, very important again. Dr. Vakil, remember, Dr. Prakash Vakil has written a book on tongues, tongues that don't lie. Many a times you can diagnose the remedy just by looking at the tongue. Look at the tongue. Use your tongue depressor. Look at the tonsils. Look at the color of the tonsils. Look at the membrane on the tonsils. Look at the glands. See, we know we are going to talk about his mind. We know we are going to talk about his mental situation. But remember, your patient is coming from an allopathic doctor to you. Remember that. You just sit across the table and ask 4 questions. He's going to say, अरे ये डॉक्टर क्या है? 2-4 सवाल पूछा, 4 गोली दे दिया, उससे क्या ठीक होने वाला है क्या? That is the first obstacle. They may not come back to you because you have not touched the patient. Touch karo. Touch the patient, examine the patient, look at the ears, look at the throat, stethoscope use karo. Remember when we go to our family doctor, the old guy, family doctor, MBBS, and when he does this, we feel, अरे टच तो किया, आपने मुझे टच किया तो मुझे अच्छा लगा. बहुत सारे अपने होम्योपैथी में ड्रग्स है, जैसे एकोनाइट है, जेल्सीमियम है, स्ट्रेमोनियम है, उनको भी आप सिर्फ टच करो और बोलेगे ना कि ठीक हो जाएगा यार, टेंशन मत ले तू, वो लोग ठीक हो जाएंगे. बिकॉज व्हाट दे नीड इज ओनली रीएश्योरेंस. एकोनाइट नंबर 1, जो डर से आता है उसके आंख में देख के बोलो कि तू ठीक हो जाएगा, मैंने बोल दिया ना, हाँ डॉक्टर साहब आपने बोल दिया तो मैं ठीक हो गया. उसके बाद शायद एकोनाइट देना भी नहीं पड़े आपको. बट एकोनाइट, जेल्सीमियम, स्ट्रेमोनियम को आप बोलोगे कि अभी तो ठीक है, हाँ मुझे तो मालूम था मैं ठीक है, मेरी बीवी ने मुझे बोला इसके लिए मैं आया था, बट एक्चुअली वो भी बहुत अंदर से डर गया है. Breath, whether the breath is offensive. Remember, remedies like mercury, breath you can actually feel when the patient enters. Having good senses is very, very important. Hahnemann says you should have all good senses. If your nose is blocked, you will never be able to smell the bad odor also, right? Even many a times people remove their shoes, socks. You can immediately feel. You can immediately find out silicia. You can immediately find out baryta, lycopodium, offensive foot sweat. Remember that. And the mother will also tell you when he comes home, when he removes his socks coming from school, absolutely very, very offensive. Okay, next. So observe the child in a clinic, his, her gestures, mannerisms, tone, expression, gather information from parents and attendants. Next. Next slide. Observe the child's reaction to stimulus in the environment. How does he react to torch? अगर टॉर्च उसके सामने एक या स्टेथोस्कोप लेके तो क्या रिएक्शन है? फॉस्फरस जो होता है वो ऐसे करेगा. हाँ, when you open your stethoscope, Hyoscyamus may also do this. Remember, Hyoscyamus may do this, but when you do this, he will. So he's scared. Hyoscyamus is in the symptom affectation. Remember, Stramonium and Hyoscyamus are in affectation. Affectation का मतलब क्या है? दिखाना कुछ और, हाथी के दांत दिखाने कुछ और, अंदर से बहुत डरा हुआ है बट बाहर दिखाता है. स्ट्रेमोनियम का एफेक्टेशन क्या है? डॉक्टर साहब मुझे कैंसर तो नहीं है ना, देखो ना, देखो इधर में बहुत दर्द हो रहा है, मैंने टॉर्च डाल के देख लिया, नहीं कैंसर नहीं, थोड़ा टॉन्सिल. हाँ मेरे को मालूम था ये टॉन्सिल है, नहीं ये मेरी बीबी मुझे लेकर आई आपको. तो बीबी बोलती मैं कहाँ लेके आई, आप ही तो आए इधर भाग भाग. दिस इज स्ट्रेमोनियम इफेक्ट. आर यू गेटिंग इट? दिस इज हाउ विल यू डिफरेंशिएट. So look at the reaction of a child when you try to use something, stethoscope or torch or whatever. Next. In every case of a child, we need to find out three things. When the disease has started exactly, what were the circumstances? So ailments from is very, very important. And how did the child react? ये three questions बहुत important है. ठीक है? As soon as a baby is put on the table, it starts crying, frightened, clinging to the mother. Stramonium, remember that. Why? Because he's frightened easily, fear of injury from place, persons. Now remember, one thing that we have done with our children is we have always given them vaccinations, right? Many of them were oral, but many of them are injectables also. So the children know that whenever we take them to a pediatrician, it is actually injection देने के लिए जा रहे हैं, है ना? Next. Another baby, when looked at, starts whistling, starts smiling, jumping. It is belladonna. Now, belladonna, in spite of a lot of pain, will smile. Remember, can you imagine somebody with inflamed tonsils, somebody with a big abscess, and the child is smiling at you? That is belladonna, remember. They are quite frivolous, they are not serious, very casual attitude, vivacious, jumping. Next. So case taking in pediatrics is more of objective symptoms. Don't rely on subjective. Look at the observations. क्या दिख रहा है आपको सामने? Asking comes later on. First is observation, remember. How the child enters, how the child sits, how the child behaves. A child coming and jumping in front of you and trying to get some kind of attention is antics. You know, there is a rubric called antics plays. Girls coming in short dresses with lot of lipstick and lot of makeup and all that. Remember? Coquettish, too much. So you have remedies like lechesis, where antics plays and coquettish both are there. You know what is coquettish, right? Too much makeup and all that, right? Understanding should be based mostly on observation, information from patient's mother. Fathers don't give the right information, remember that. So don't rely on father information. Until and unless he's a father, when there is no mother, remember that. Then the father will give the best information. Because there the father is acting as a mother and father, right? But when the mother is there, please don't ask father. Pregnancy history, family history, past history, and the miasmatic understanding. Okay. So I think this is enough for today. Too much overload. Maybe we can do another session. If you have any questions, we can leave for 5 minutes. Anybody has any questions? I hope you will be able to use some of this in your practice. And I'm sure, yeah, exactly. Thank you. Thank you very much. Try to use this in your practice. Whenever first is, I always tell all my students, of course, you all are my seniors, but all my students, I tell that when you go in the bus, train, metro, observe people. These observation will give you a lot. Remember, see serials, see movies. I always tell my students, please watch some movies. They teach you so much of materia medica, you know. I have learned most of my materia medica from movies. Yeah. Any questions? Yeah. और touchy to destroy. That is also very good. अभी सल्फर अच्छा आएगा तो एक आपका चीज देखेंगे सल्फर को क्या है, लिक्विड क्या होता है, कहाँ पे बना है, ये सब उसको मालूम होगा. सल्फर चिल्ड्रन आर वेरी वेरी वेल ब्रेड स्टूडेंट्स. एक छोटे बच्चे को पूरी गीता आती होती है. These are very very knowledgeable children. मम्मी बोलेगी हमारे घर में इसका लाइब्रेरी बना के रखे. And he just wants to read individual orations. That is what is value philosopher. So we ये कबाड़ी वाला होता है ना, इसके बाद बुक्स वगैरह बहुत करते होते हैं. सल्फर आपको सबसे ज्यादा वहां पे मिलेगा. नॉट डिवाइस का कबाड़ी वाला, लेकिन पहले का वाला बुक से ठीक है करती है. Yeah, the one who comes and tell you, like to destroy the thing. Maybe you want to put it directly. Very, you have to get the whole thing. You can really destroy. Whether it's looking for knowledge or whether it's looking for business. That's, yeah, that's inferiority also is sulfur. That's inferiority. But white lens is also dark. So that's करके देखना है. That's करके क्या है? कहाँ से आया है? ये जानना. Yes. I am confident. I have a lot of friends in Bombay who are practicing this way. So I'm not saying that these are right, but I want it to be very important. I am using my practice. You also use my practice. They don't share. Normally, don't practice. When I went to Spain, just 2 minutes ago, when I went to Spain this time, I saw that there were so many countries there and so many people practicing homeopathy. And we are in the demonstration homeopathy is India में very India में हर जगह करी. पेरू जैसी छोटी कंट्री करी, अर्जेंटीना, पेरू, ब्राजील. Small countries, homeopaths are working, and every case they are referred like they are doing properly. Sometimes we in India are taking homeopathy for granted because we see a lot of patients. वहाँ पे एक भी पेशेंट आता है तो उसको पकड़ के पूरा रेफरेंस लाइट करना, डिटेल में उसको पूछना, सुबह से लेकर शाम तक उसको बिठा के रखना. इतना सिंसियरिटी है. So if we remain like this, some other country will go ahead of us. So don't let everybody go ahead of us. India should be number one of it. But our attitude towards our patients, our attitude of taking homeopathy for granted, we should take homeopathy seriously. Because the world is taking homeopathy seriously. There has been a lot of research in homeopathy. A lot of research is done in homeopathy. We need to create evidence-based homeopathy. I appeal to all of you. Whenever you see a patient, please take a photograph. Please. If you see even a
small watch, take a photograph. Because if that watch disappears to your treatment and be happy, take a before and after photograph, keep it in your phone. PCOS, very, very good homeopathic treatment. Before and after, thyroid, before and after. Keep all these reports with you. In our OPDs, in our private practice, please do this. Because ultimately, what is going to count is evidence-based practice. Remember, on a diet like this, you cannot just say, ठीक कर दिया मैंने thyroid. Nobody, सब लोग हंसते हैं. मैंने lycopodium किया और thyroid नहीं होता. Autism, when I'm seeing autism, I have to do all the psychological tests. Symptomatic, you hyperactive था और शांत हो गया, कोई मार्कर नहीं. You have to show that test before and after. So please use your mobile for all other purposes and also take photograph. You know, for criminal case, right? So you have to ask them, what is the offense that you have committed? You have to break the rule. Many times you have to break the rule. Operation का मतलब क्या होता है? इसको डॉक्टर के पास जाना, डॉक्टर के पास जाना इसलिए this culture fear of dentist भी है, ये सब इसकी मैं break कर find out where exactly the fear is. Whether it is actually the actual operation का डर है, injury का डर है, or just going there, anesthesia है, whether I'll get up or no, whether I'll die, what is the fear you have to find out? You'll have to break it, I think. Fear of injury is not related to operation only, no? Yeah, so what are the remedies? Both में stramonium तो है, ISMS भी है. I would rather to try to open up the room. That's what my experience is. Anyway, it's open to discussion, so we'll have to find out. Anything else? Yeah.
Sir. No. Sir, I have seen the patient who are autistic children who are banging the head. Especially they are intelligent also, but I couldn't differentiate between tuberculinum and tarantula. So what can, both are the autistic, cannot speak.
You just spoke of the difference. Main difference between tuberculum and tarantula is the cunningness. Second thing is when tarantula is banging his head, there won't be any injury. The injury will be very, very less. They are very, very manipulative, deceitful. You will never see any injury on his head. Tuberculum, when they injure, they really injure themselves badly. Remember that. Yeah, but stop. But there are many kids who will, also bang on the sofa, not always on the wall. And as I have told you, see, some symptoms are always there, but you'll have to also take some physical minerals also. Tarantula will have a lot of pica, remember. Eating dust, eating rubber, pencil, all those things. Tuberculum will always have craving for cold drinks and ice creams. ये दोनों में जब भी मैं मेंटल्स में थोड़ा कंफ्यूज हो जाता हूँ आई ऑलवेज फिजिकल जनरल्स को पास जाता हूँ यू कैन डिफरेंशिएट बेस्ड ऑन फिजिकल जनरल मेंटली कभी कभी कंफ्यूजन हो जाएगा बैंगिंग हेड में ठीक है थैंक यू ओके सो थैंक यू वेरी मच थैंक्स टू डॉक्टर राजेश्री फॉर बीइंग हियर इज अ बिग सपोर्ट एंड इंस्पिरेशन फॉर मी my friend Dr. Mahesh has also come here so thanks to all of you thanks
Thank you so much, sir. It was definitely an enlightening program. And we got much to learn from your practical experience, sir. Definitely it was worthwhile learning from you, sir. Thank you so much, sir. Next, I would like to call upon Dr. Gautam to introduce about the STSH program for students. Dr. Gautam.
Good afternoon, everyone. Thank you. Thank you for the response. Yeah, now moving ahead for the next session, we are inviting the interns of Hamsa Homeopathy Medical College and Hospital Research Center for presenting their STSH, short-term studentship in homeopathy. It's a research program, what they have gone through in the internship. So they'll be giving a presentation, three of them. First of all, we would like to call upon Ujita Raj.
Good afternoon, everyone. I'm Dr. Ruchar Pusaraj from Hamsa Homeopathy Medical College, Hospital and Research Center. Today, I'm going to talk about my short-term studentship program, which is common yet often underestimated clinical condition and a clinical practice, that is post-dural puncture headache. Now, let's start with a scenario. Imagine a patient comes in with a simple diagnostic lumbar puncture. A few hours after the lumbar puncture, he develops some severe debilitating headache that worsens when he stands up, sits, etc. This is a classical presentation of the post-dural lumbar puncture headache, a condition that is significantly impacts the patient's recovery and his comfort. Now let's discuss about the introduction of the post-dural lumbar puncture headache. It is also called as post-lumbar puncture headache. This is caused by the disruption This is caused by the disruption of the dural matter of the spinal meninges that is caused during the spinal anesthesia puncture. The spinal anesthesia puncture is done at the level of L3 and L4 lumbar vertebrae. It is defined as a bilateral headache that occurs within 7 days of the lumbar puncture and disappears within the 14 days, which worsens within the 15 minutes of resuming the upright position and disappears within 20 minutes of resuming the recumbent position. Let's discuss the mechanism. The mechanism of this post-dural lumbar puncture headache is not yet clear, but it is thought to the leakage of the cerebrospinal fluid during the puncture hole made by injecting the needle. Due to this leakage of the CSF, the CSF leakage is more than the rate of production. So, because of this leakage, there is a lowering in the pressure of the fluid. The clinical features includes positional nature of bilateral, frontal and occipital headache that is of throbbing or dulling nature, which tends to worsens in the first 24 hours. The symptoms are aggravated by sitting, standing, and ameliorates by lying flat. The associated complaints includes neck stiffness, vertigo, tinnitus, diplopia, cortical blindness, etc. The risk factors: the females are more prone to develop these conditions than males. When in seeing age, both the extremes of the age groups are having a lower incidence in developing the PDPH. If there is any history of the previous headaches, the diagnosis. Let's talk. It is purely based upon the clinical presentation. If the imaging, like a CT or MRI is performed, we'll see the findings as a smaller ventricles, downward displacement of the brain that is sagging, engorged cerebral venous sinuses, subdural fluid collections, pituitary enlargement, and diffuse meningeal enhancement. The complications include meningitis and bleeding. Now let me explain about my STSH research process, what and how I did during the management of the PDPH. These are the aims and objectives I have taken for my study. The aims to assess the effectiveness of the homeopathic medicines in the management of post-dural puncture headache. The objectives were to understand the effect of spinal anesthesia on the health of the individuals and to find out the common symptoms. To understand the efficacy of homeopathic medicines in PDPH. The inclusion criteria were the subjects who are the post-surgical anesthesia patients are considered, and age groups of 16 to 84 were included in the study, and both the sexes irrespective of the socioeconomic status. Diagnosis was based on clinical presentation, and the cases are taken which are under the scope of homeopathy. Exclusion criteria: the headaches of other causes, cases with irreversible changes, and cases which are already under the treatment other than the homeopathy. The materials I have used a case report form as a routine case pro forma, and I have taken an informed consent form with a master chart with a computerized repertory chart, and repertory I have used a synthesis repertory. Methods were the sample size of the study was 30 patients and 30 subjects were selected, and duration of my study was from March 2024 to September 2024. The results of my study. The remedies most commonly I used were arnica, belladonna, hypericum, and pulsatilla. These remedies were taken based on the totality of the symptoms. I have also prescribed natramur, lachesis, causticum, and ars alb were also prescribed. Conclusion. This is the master chart. These are the 30 cases what I have taken during my study period. Conclusion. Out of 30 cases, 24 cases have shown a better improvement in the condition, and remaining 4 cases were yet to improve. And during my research experience, I have struggled with narrowing down my research question, but through trial and error, I learned how to refine my focus and to develop a structured methodology. The homeopathy system has a scope in treating these patients and these cases when compared to the other systems. A properly taken and well analyzed case with a suitable homeopathic remedy can treat these patients. Since the clinical profile of the PDPH has been studied and remedies are employed following the principles of homeopathy. The present study has fulfilled all the objectives I have taken and showed a statistical significance by achieving the positive hypothesis. I would like to thank our director, Dr. Umesh Akaladevi sir, Dr. Padmaja Akaladevi ma'am, Principal Dr. Nuri Sahir Khan, Vice Principal Dr. Srinivas Babu Katti sir, and my guide Dr. Nisha Arvind ma'am for giving me a constant support and helping me in having a wonderful experience and completing my research work. Before I wrap up, I just want to say a heartfelt thank you to all for being here today. I hope you found the information helpful, and I look forward continuing the conversation. Thank you once again.
Thank you, Pujita. That was a wonderful presentation. Next, I would like to call upon the dais, Renka Sushma.
Good afternoon, everyone. Good afternoon, everyone. My name is Sushma Dunku, and I'm delighted to be here with you today. I would like to extend a warm welcome to all of you for attending this seminar. Today, I'm going to explain briefly about my research topic, alopecia. So, firstly, to go deep into my research topic, I would like to give a brief introduction about alopecia. It like that, what is alopecia and what are the causes and how it is affected to the person. So, firstly, alopecia. Alopecia is characterized by a loss of hair. It is characterized by excess fall of hair in bunches from a particular area of head or beard. Hair loss is commonest problem affecting every other person around us. Almost people around the world suffer from it. Like alopecia అంటే చాలా మంది లైక్ కంప్లైంట్ చేస్తారు, నాకు హెయిర్ ఊడిపోతుంది, నాకు జుట్టు ఊడిపోతుంది అని చెప్పి. సో అలోకేషన్ అంటే చిన్న లైక్ నాట్ కొంచెం ఊడిపోతే కాదు, లైక్ ఇట్ హ్యాస్ టు రెడ్యూస్ ద బంచ్ ఆఫ్ హెయిర్ ఫ్రమ్.
The word alopecia is a medical term for hair loss. Alopecia describes the loss of hair from areas where hair normally grows, like beard and scalp. And it comes in a variety of patterns with a variety of causes. So the main variety of various forms are alopecia areata, androgenetic alopecia, telogen effluvium, and alopecia totalis. Alopecia areata means it is autoimmune disorder causing patchy hair loss. And whereas androgenetic alopecia is a pattern baldness. And alopecia totalis is if left untreated or if the disease does not respond to treatment, it results in the complete baldness. And telogen effluvium, temporary hair shedding triggered by stress or lifestyle factors. It is usually seen more in students. And alopecia universals, where the entire body suffers from the complete loss, such as in chemotherapy. Next. The main causes of alopecia is stress. And next, academic pressure, our lifestyle changes, and nutritional influences, hormonal effects, and environmental damage. The chronic stress can induce the telogen effluvium, where a large number of hair enters the resting phase prematurely and causing diffuse hair shedding. Usually, the most stress is seen in the students. So my motto is to select this topic is everyone is coming and complaining, I have this much hair loss, I have that much hair loss. Mostly we seen in the undergraduate students because they can't able to cope up with the stress and they're feeling more and more pressure. So my topic is aims and objectives to evaluate the effect of alopecia on health and assess efficacy of homeopathic medicines in alopecia. The objectives are to evaluate the effect of alopecia on health, to assess efficacy of homeopathic medicines in alopecia, to know the common homeopathic medicines in management of alopecia, efficacy of constitutional homeopathic medicines in treatment of alopecia. So, if we have hair fall, we'll approach morely to the allopathic treatments like hair transplantation, laser treatment, etc. So, I got an idea why our homeopathy does not have any medications to treat this hair loss. So, this is my main motto to take this topic as a research. So, the inclusion criteria is those patients who had hair loss at least for a 1 month duration and age 20 to 40 years and both the sexes, chemical or drug induced hair loss. These are my inclusion criteria. And I excluded is pregnant women, lactating females, HIV patients, patients on chemotherapy. This is a questionnaire which I found while I asking questions to the hair loss patients. These are some of the questions which I asked them and asked them to fill this form. Next. So these are the remedies I got. Arnica, calcareous phos, fluoric acid, natrum muriaticum, phosphorus, puja. So mostly I prescribed natrum based on their particulars and the main causation of the hair loss. And to my surprise, I got fluoric acid to the limelight. Actually, I don't know that fluoric acid will work best in alopecia, but I surprised about this remedy. And next, calcareous phos. Calcareous phos, it was given to the 3 subjects, and based on their constitution, we prescribed this remedy to the patients. Next, natatomy was given to the 13 subjects based on the emotional stress and introverted subjects, patchy hair loss with a dry, cracked hair. Next, the 9 subjects were shown the better results, and the phosphorus were given 8 subjects to the diffuse hair loss and hair loss while hair forming and hair loss with dandruff. Next. So these are the graphs where the arnica, calcareous phos, fluoric acid, natrum muriaticum, phosphorus, puja were given. So out of 30 cases, I got the best results in 20 cases, yet 10 need to be improved. So I'm working on that. So conclusion, as a result of my research work as appropriative, I can say that homeopathy got a scope in manifesting the alopecia. So the alopecia was selected considering the patient as a whole, which proved in homeopathy, and there are specific for patient, not for the disease. So my research created awareness among the people about the causes of hair loss. So only based on one symptom, it is hard to prescribe a remedy. So this becomes a commonest problem in many of the patients due to the work stress and pollution. Educating the patient about the problem plays a major role. The subject should also change some of the changes. Not only the medications, but they have to change their lifestyle and their environmental changes. Based on all this, we can we can prescribe a remedy and we can give the better results to them. Thank you. Uh, before we conclude, I would like to take a moment to express my deepest gratitude. First and foremost, I would like to sincerely thank our external director, Dr. Padmaja Devi Akkaladevi ma'am and Dr. Rameswar Akkaladevi, and our principal, Dr. Nuri Sahar Khan, and our vice principal, Dr. Srinivas Babu Karti, and our guide, Dr. V.V.R.K. Avinash, and all the professors and friends for their unwavering support, guidance, and the invaluable opportunity to present this seminar. Your encouragement insights have been instrumental in shaping my understanding and approach to this step. I would also like to extend a heartfelt appreciation to the management team for organizing this event, for providing such a wonderful platform for us to share knowledge and engage in the meaningful discussions. Thank you.
Thank you, Sushma. Next, I would like to call on Sayeda Muskan Ali for a presentation.
A very good afternoon to one and all present here. So, I am Sayeda Muskan Ali, intern from Hamsa Homeopathy Medical College. I am here to present my topic, which is a clinical study on complications of COVID vaccination and its homeopathic approach. So, as we all know, about COVID, so I'll just give a quick recap. COVID-19, it is an infectious disease which is caused by severe acute respiratory syndrome coronavirus 2. And the first known case of COVID, it was identified in Wuhan, China in December 2019. Coronaviruses, these are single-stranded RNA viruses. So these are spherical or pleomorphic in shape. So the word corona, it means nothing but crown. So it depicts the form of a crown, which is nothing but due to the spike glycoproteins present on the structure, and it is an enveloped RNA structure. Next is it belongs to the family of Coronaviridae. Next, the symptoms of COVID-19, they are cough, headache, fatigue, fever, etc. Next, the genera which mainly infects human beings, that is torovirus and alpha coronavirus. So as we can see, how is it spread? So the mode of infection is through respiratory droplets and also with contact transmission when a person gets in contact with some surface or anything which is contaminated with the virus. And next is the airborne transmission, which is nothing but when in closed spaces, the small virus containing aerosols are present in the air. So that is the mode of transmission. Next. So the major vaccines which were given in India were Covaxin and Covishield. So as we can see, Covaxin, it is an inactivated virus vaccine. The technology used here is a killed version of SARS-CoV virus, and this method, it will not cause any disease in the body. Next, coming to the Covishield virus, viral vector virus. This is a type of viral vector virus where a vector is used, that is a weakened version of chimpanzee adenovirus is used with a genetic material from SARS-CoV virus, spike protein. Next. So as we all know that we have bad effects from vaccination. So in the book of Genus of Homeopathy by Stuart Claus, Dr. Stuart Claus has mentioned that inoculation of crude pathological products like animal sera and vaccines, only it confers a spurious immunity, which is nothing but a false immunity through destruction of the normal susceptibility. It also results in poisoning of an entire organism and sets up a morbid condition instead of a healthy one. The correctly chosen homeopathic remedy upon the indications of the symptoms of the disease as manifested in the individual in infinitesimal doses, it confers a true immunity. Next. So I would like to explain the previous slide, which is nothing but effects of vaccination. So according to Dr. Stuart Close, he explained that the vaccination, it will disturb the natural susceptibility of a person, and it will alter the body's susceptibility, and it will create some artificial morbid condition. So this susceptibility, it is actually important and it is an inherent quality of our body to fight any disease. So when it is disturbed, that it will disturb the whole harmony. Next is the body. Instead of responding naturally to a disease, it is forced into unnatural state where the body is not capable of healing itself. So this suppression of natural susceptibility, it will weaken the organism's ability to heal completely if any other further diseases attack. So mainly the natural susceptibility will get disturbed. Next is the disturbance which is caused by vaccination. It can lead to a state where the organism is predisposed to deeper and chronic conditions. Rather than resolving the underlying susceptibility, the vaccination, it will mask it up, and because of it, a morbid condition is formed. And in the body, it may even give a chance for new conditions or new forms of diseases. Next. Aims and objectives. My aims here were to understand the effects of COVID vaccination upon health, and also to study the scope of homeopathy in managing cases with post-COVID vaccination. Next is the objectives were to evaluate the bad effects of COVID vaccination upon health and to evaluate the efficacy of homeopathic remedies in complications of COVID vaccination and to find out common symptoms which were shown after the COVID vaccination complaints. Next. Next slide. So here the inclusion criteria was cases of all age group and also both genders, and patients who were previously healthy, like before taking vaccination who were healthy, they were considered here. And patients with acute exacerbations of their existing conditions, after vaccination, they were also included. Next, the exclusion criteria was patients with severe complications and also very mild complications were excluded. Next. So this is the result which I have got. I have totally prescribed 12 remedies basing upon the totality of the cases. So the topmost remedies were Tuja, Silisha and Arsenic album. Out of 7, 5 improved with Tuja. And next is Silisha. Out of 5, 4 improved. And with Arsenic, out of 4, 2 improved. Next. Next slide. So here is, I have taken 30 subjects. So amongst them, who have taken Covishield is the number of people who have taken Covishield was more and Covaxin is very less. And next is the systems involved. So here the major systems involved were musculoskeletal system, nervous system, and then comes the respiratory, digestive, and integumentary. Next. During my study period, most of the patients who were affected were mostly with arthritis, and next coming to fibromyalgia, allergic rhinitis, and also headaches. These were the most common cases which I got during my study period. And next, the bar graph beside, it shows that the number of subjects who were tested and who were improved. So as you can see, Tuja, Silisha, and Arsenic album, these were the top 3 remedies. And I would like to share that homeopathy, it has worked well in cases where there were acute exacerbations of the already existing conditions. So with this, I conclude my topic. And I would like to also tell that Puja was only used for deep-seated issues after vaccination. And next is Silisha, when the immunity was weakened in the patients. In those cases, Silisha has helped. And also arsenic album, it was helped in most of the cases where there was acute exacerbations. So with this, I conclude my topic. Thank you. I would like to take a moment and thank my directors, Dr. Umesh sir, Dr. Padmaja ma'am, and also Principal Dr. Nuru Sahar Khan ma'am, and all my professors. And I sincerely thank my guide, Dr. Srinivas Babu Katti sir, and also Boini Kavya ma'am for helping me out throughout the course of the study. And I thank Dr. Gautam sir and all the dignitaries of HMAT who have given me this opportunity to share a glimpse of my work. And lastly, I would like to extend my heartfelt thanks to my family, friends, and also the audience here for your presence and attention. And it is greatly appreciated. Thank you.
Thanks a lot, Muskan, for your presentation. So I would like to thank on behalf of Hamsa, Team HMAT, for giving the interns the opportunity to give their presentations on STSS, whatever the program they have done. And I would like to thank Hamsa on behalf of HMAT for coming here and showing your participation. Thank you very much. I'll like to call Annapurna Madam to take over. Thank you.
Indeed, it was a wonderful session. Thank you, students of Hamsa, for coming here and making an effort for presenting these wonderful sessions. Thank you so much. Now, moving ahead, we would go for the next session. We would have a felicitation of our speakers and the guest of honor. So next, I would like to invite onto the dais Dr. Gopal Krishna sir, our president. I would like to invite Dr. Gopal Krishna sir, President HMAT, onto the dais. Dr. Durga Prasad Rao sir, Dr. Venugopal Gauri sir, Dr. Rajshri ma'am, Dr. Manik Prabhu sir, I think he is not there. Now I would invite Team HMAT for felicitating our speaker for the today, Dr. Samir Chokar sir. Sir, check. I think the speaker is not available at this moment. I would request Dr. Samir Chokar sir, please come on to the dais, sir. I acknowledge the presence of Dr. Mahesh Pagadala sir here. Please come on to the dais, sir. Dr. Umesh sir. Thank you, sir. Next, I would like to Next, we would like to felicitate Dr. Umesh sir, who is the who is the chairperson and faculty of Hamsa Medical College. Please, sir. Now, I would like to felicitate Dr. Mahesh Pagadala sir on behalf of HMAT. Next, we would like to honor our sponsor for today, Dr. K.S. Gupta sir, and we would request Dr. Mahesh Pagadala sir to please accept the honor on behalf of sir. So students, I request all the dignitaries on the dais to please occupy the seats. Thank you, everyone. So students, how was the session? How many stars? How many likes? And how many hearts? So indeed, this. So anybody want to speak a few words about your experience, what takeaway you have got from the session, how it is useful in your practice? Anybody? Anyone? Who would like to come and share? Sir has spoken for almost 1.5 hours. At least one person to speak at least for 2 minutes. Please. Anybody? Nobody? Anyway, sir has been a renowned international and national speaker. He has been a wonderful, amazing practitioner with years of experience in autism and pediatrics. I really, my heartfelt thanks to Sir Samir Chokar, sir, for coming all the way from Bombay, sir. I understand you have been very busy with all the meetings, all the orations happening all around the world. Thank you so much for being here, sir, today. Thank you. Thank you. Next, I would like to invite Dr. Mahesh Pagadala, sir, to speak a few words and enlighten us about the legal proceedings which have been happening, sir. Please, sir.
Good afternoon, everyone. Good afternoon, respected Dr. Umesh, Dr. Manik Prabhu, Dr. Gopal Krishna Garu, Dr. Srinivas Kathi, Dr. Samir, my friend, Dr. Rajeshri Garu, and all the faculties who have come all over the way from Hamsa, especially the students. I have to give a big applause for the faculty and the management and Hamad for both together come and join collaboratively going towards the knowledge drive. That's wonderful. The same such type of drive which is going on the knowledge, it's not only in Hyderabad or any other or the parts of India. We are doing such drives even in India on behalf of IHP, Indian Institutes of Homeopathic Physician also. We are in collaborative with all the colleges also. We are going to conduct some seminars and webinars also in their premises also. In such a way, overhead is LMHI, Liga Medical Homeopathic Association, that is internationally. They are conducting different type of world conferences. They are gathering all the doctors all over the globe. They are bringing them into one platform, sharing their experiences. It is actually, that is a good platform if you want to learn. If you are having a very deep crave for the knowledge like that is a good platform to know a different. Here we'll be saying like only in Indian, whatever the ailments or the disease, what we are saying, how we are treating, depend upon the area wise also. In different countries also, you will see different type of picture of disease over there and how the drug pictures will change from here to there. That you can learn a lot of things. And such platforms try to ensure from most of all the students try to get enrolled, and it is an open platform. You can submit your papers also for the For the presentation, there is paper presentation, oral presentation, and poster presentations are also there. These things you can approach them. Only few people from here, I think, from Telangana and AP, I think my paper got accepted over there on dermatological cases with homeopathic approach. And Dr. Samir also, he was there. So few doctors from India, they have come all over to, their papers got accepted over there. So you can also try the way the doctors were there showing the presentations and everything in the same way, a little more. You have to shine up. Of course, Dr. Srinivas Kati and all other guides are there with you, with your people, your faculty. They will help you all. Hope in the next Liga, which is going to be in 2025, like that in Netherlands. So it will be another opportunity for you people. After that, it will be in Bangladesh. Okay. So it is that place we have to think about going also. Anyway, thank you for giving this opportunity to just show a few things about the Liga also. Thank you very much. Bye.
Thank you so much, sir. Now, we are coming almost to the end of the first morning session. I hope we all had a very wonderful time over here. And let me introduce a little about the second session post-lunch. We are going to have our speakers, Dr. Srinivas Babu Kati, sir, Dr. Lagnajita Ravi, ma'am, and Dr. Abhijit. So, and followed by the most wanted quiz session. I think you all are waiting for the quiz session, right? Yes. So once we are done with this session, we'll disperse for lunch, and post that we are having the 3 speakers followed by a quiz. Okay. So let us all disperse for lunch now. And I think we'll be coming back at what time?
1 or 2 o'clock.
2 o'clock, around 2 o'clock. Thank you, everyone. Lunch is on the second floor. So I request everybody to go slowly and do not crowd over there. And see you all back at 2 p.m.